This meeting is being recorded.
Welcome everyone to day 2 of our board meeting. I am Greg Lippy, board president. As part of my opening comments today, I advise everyone that immediately following our meeting, the board will be convening on an emergency board meeting. The agenda for this emergency meeting is posted on our website. We will be using the same WebEx event for the emergency meeting. Additional information is posted on our website. As we begin today, I will ask the moderator to review the process the board uses for individuals to provide public comment during appropriate times. Moderator, it's your turn.
Thank you, President Lippy. This is Shelley, and I will be your moderator today. Welcome to the meeting. To facilitate public comment, we will be utilizing the WebEx question and answer feature. When President Lippy reaches a point in the agenda at which public comment is appropriate, he will request public comment, and at that direction, I will turn on and announce the opening of the Q&A feature. At that time, we will display instructions on the screen as we are now for your use and reference. You will be asked to click on that Q&A icon at the bottom of your screen. You will type, "I would like to make a comment," or "I would like to make a public comment" in the Ask field and submit that to all panelists. It is not necessary to identify yourself in order to make a public comment. We will be taking comments in the order that they are received. I will call on your name, unmute your microphone, and let you know that you will have a 2-minute speaking time. I will be providing a 10-second reminder. At the end of the 2 minutes, I will mute your microphone. Please know that the Q&A feature is being used only as a means for the members of the public to represent that they would like to make a verbal comment. All of your comments will need to be made verbally. And this is not a means for you to ask your question in the context of the text of the request. Anything that's submitted that way will be dismissed. And with that, I turn the floor back over to President Lippy.
Thank you, Shelley. I'll now take a roll call to establish a quorum. Ryan Brooks.
Here.
Thank you. Cheryl.
Here.
Jill Butler. Thank you. Shirley Kim.
Here.
Thank you. Sung Oh.
Here.
Thank you. Jig Patel.
Here.
Thank you. Ricardo Sanchez.
Ricardo Sanchez, public member.
Thank you. Maria Serpa.
Here.
Thank you. Debbie Veal.
Here.
Thank you. Jason Weiss. Is Jason here?
Here.
Oh, thank you. Okay, and I guess Albert Wong has not come in yet. Okay.
Not as of yet.
Okay, let's move on. Okay, we're at agenda item 10, which is discussion and consideration of comments on board approved regulations, proposed comment responses, and adoption of regulations. Members, as included in the meeting materials, we will now consider the proposed regulations to add Title 16 CCR Section 1717.5 related to automatic refills. As you may recall, during the September meeting, the board voted to amend the regulation language and release the language for a 15-day public comment period. The comment period ended on October 10th, 2020. There are several items included in the meeting materials, including comments received during the 15-day comment period, summaries of the comments received with recommendations, and the proposed text that was released for the 15-day comment period. I trust members have taken the opportunity to review all of the meeting materials. As we begin our discussion, I ask members to provide your thoughts on the comments received and staff recommendations. As part of your comments, please offer a motion if appropriate. A possible motion is provided in the meeting materials that would facilitate adoption of the language as noticed for the 15-day comment period. Okay, I'm going to take a roll call for member comments. Sung Oh.
I'm okay right now, but I'm sure there will be a lot of discussions on the A, so I will wait and we'll have more of a discussion later on, I'm sure.
Okay, thank you. Ricardo Sanchez.
I'm in the same mode here. I I'm fine with what we're doing right now.
Okay, thank you. Maria Serpa?
I have no additional comments. Since the last board meeting, we had a very robust discussion on this, and I'm sure there'll be a little bit more today too. Thank you.
Yes, we did. Thank you. Okay, Jason Weiss? Remember to unmute.
No additional comments at this moment.
Thank you. Jig Patel?
No additional comment at this moment, but we'll definitely have a discussion about it, and we'll talk more about it
Okay, thank
today.
you. Okay, Shirley Kim?
No comments at this time.
Thank you. Ryan Brooks?
None.
Thank you. Cheryl Butler?
No comments.
Thank you. Okay. It's time to open up for public comments.
Not me.
How could I do that?
I don't know.
Sorry, do you have a comment?
Well, I mean, I guess my comments are pretty much just a repeat of what we talked about last time. And I know we did go through this, but you know, one of my comments is just the process of enrolling, and before I'm trying to think. So right now, we have before the patient enrolls, the pharmacy provides written or electronic. And actually, one of the commenters said, maybe we think that before a prescription is dispensed for the first time. So anyway, I do think there is some fine tuning of the language that's needed.
Okay, thank you. Now I will go to public comment. Shelley, can you open the lines, please?
This is the moderator. I've opened the Q&A panel for submission of requests for public comment. If you'd like to make a public comment, please click on the Q&A icon at the bottom of your screen, type "I would like to make a comment" in the Ask field, and submit that to all panelists. We will now pause for a brief moment to allow time for submission of requests. This is the moderator. We have a request for public comment from Lori Walmsley. Lori, your microphone is unmuted. You will have 2 minutes.
Hi, Lori Walmsley on behalf of Walgreens. Just to address the comment that I submitted, it was the comment I believe that Ms. Veal was referring to. My recommendation is that under A sub 2, that the board look at a modification to the language that says before a patient is dispensed to the patient for the first time using an automated refill program versus before the patient enrolls. It gives the pharmacy the flexibility to implement it in different ways, knowing that there's multiple ways that patients can sign up for auto refill, either via automated text messaging, the internet, etc. It just gives us more flexibility. We would still give the patient the information that they need prior to the patient actually receiving the prescription for the first time. So I would encourage you to look at making that modification. I appreciate it. Thank you.
Thank you, Lori.
At this time, we have no additional requests. Would you like me to close the Q&A panel?
Yes, please.
It is closed.
Okay. Okay, we're back to members. I think a number of you indicated that you may want to say something after public comment, so I will go back through the roll again. Sung-Oh.
I am actually feeling satisfied with our board staff has done. So I'm not sure if I can make a motion already, but if I can, I would like to make a motion to adopt this regulation as fixed and tested, recommended by our board staff.
Thank you. Yes, you can. So as I go through, I'll be looking for a second on the motion.
President Lippy, I had a comment to make.
Yes.
Just looking at the patient safety and adherence of a lot of individuals that are already enrolled in this autofill program at various pharmacies. I feel that going through all the new steps for all existing patients on autofills would cause unintended consequences due to this changes. And I feel that we got to implement this prospective and not retrospective, so to speak.
Okay.
So the requirements that are here that are amended, and like as Sung said, the board did a great, the staff did a great job of amending it and changing the words out and making it more effective to protect our consumers. At the same time, we don't want to harm anybody that's already enrolled in this. And for that, I would like to make a motion that it be prospective and not retrospective. So leaving all the folks that are already enrolled, only the new patients and new prescriptions after it's implemented will be affected.
Okay, we have Sung's motion, so we have to deal with his motion first if he gets a second. So stand by and
Albert is here.
thank you, Albert. Sung, did you want to change your motion or do you want to keep it the same?
I'm actually, I'll withdraw my motion and just see if there's any other comments. Then just because I know that this is a big deal. I do also, I don't want to cause too much confusion, but I mean, I also am kind of very sympathetic to the comments submitted by the independent pharmacy owner that is allowing changing the rule to exempt independent pharmacies. But again, I don't want to cause too much confusion and changes, so I will and stand by.
Okay, so you've withdrawn your
President
motion.
Lippy?
Yes.
Hi, sorry to interrupt. This is Anne. One of the things that the board may wish to contemplate that may provide for some sort of a transition period would be to maybe establish an effective date. Typically, once it goes through the entire rulemaking process and it's approved by the Office of Administrative Law, it will take effect the next quarter. But the board has the flexibility to establish a different effective date. So if part of the concern is allowing time to transition because there is the annual requirement as well, it may be, the board may wish to consider as part of its discussion whether or not a different effective date, and like as an example, make it effective July 1 or something, and that would allow for plenty of time and address some of the concerns that I've been hearing. Just an option.
Thank you, Anne. Jig, does that work for you?
Absolutely, because there are millions of folks that are enrolled in this, and if we put a date, like Ann suggested, July 1, 2021, it gives ample time for everybody to comply, and nobody is unenrolled or disenrolled from autofills, and there is no patient safety and adherence issues out there.
And since it's an annual requirement anyway, you know, it covers it, I see.
In that case, I am more than happy to put back my motion again.
Okay, so you're going to withdraw your motion, or you're going to make a motion to put an effective date?
Yeah, I'm going to make a motion to put an effective date as Anne suggested.
Okay. As effective date on July 1?
July 1st, did you say, Anne? July 1st, 2021? Or July? I mean, I think
what she said.
This going through the whole regulatory process will take at least, I would say, 6 to 9 months. So July 1st, 2021 probably is a safe date.
Okay, so that is your motion then to,
Well, wait a minute, so think about that. If it takes 9 months to go through the
That's
process,
Jim.
hey, can
Yeah.
if it
What do you
takes
think,
like
Debbie?
9 months to go through the process,
Should we do September then, or October 1st?
well, yeah, I'm thinking, do you want it like 2020? I think, yeah, we need to give the pharmacies like a full year. So I don't know if you want to make it January 1st, 2022, or September 2021, but let's give them, I agree with you, it takes a while to go through the process.
That's right. I think January 1st, 2022 makes sense. So,
I'm okay with it.
So your motion is for effective date January 1, 2022.
That sounds good to me.
This is Ryan Brooks. I'd second that.
And this is
Okay.
Eileen, just to make sure that other than this change, the motion is to accept the text as provided and
Correct.
reject the
That is
submitted by
correct.
the commenters?
The motion that he made was to accept the current version that has been has been dealt with over the 15-day comment period, but to make an effective date of January 1, 2022.
Thank you.
Thank you. Okay, so that's our motion. Member comments?
This is Ryan Brooks. I do have a comment,
Yes.
Mr. President. I listened to the speaker in an open session, or public comment time. There was a question to change the lines and say before prescription is dispensed to the patient for the first time using automatic refill program. Can we insert the word before?
Well, she was talking about before enrollment, not before the first prescription.
And what would be the effective difference?
Well,
This is Anne. I'm sorry. I believe when the board previously discussed this, they were talking about informed consent. And so they felt that the informed consent needs to happen before someone enrolls in the program. I think if you change the language, that will be a policy shift because they will essentially be enrolled in the program, and then informed consent will happen prior to the dispensing of the first prescription.
So, but and right now the language says before enrolled, right? It's correct.
Yes, before enrolled.
And so if we change the language to before dispensed, do you think that's a policy issue?
So the dispensing, that to me believes that they have enrolled before they have given the consent, because they said before it's dispensed for the first time through the auto refill.
Maria, just to be clear, I think there's a confusion for maybe some of our non-pharmacists. The way I understand it, this is a program that is for the patient that covers all their prescriptions, not one prescription at a time.
right.
So referring to dispensing or first prescription or those kinds of things would really muddy the waters. They enroll in the program, and then their future prescriptions or their prescriptions would be qualified.
So therefore, Ryan, do you want to leave it alone or what?
No, but it still just doesn't make sense. I mean, why won't we do it before it was dispensed?
Well, it is before it's dispensed, but it's also before they enroll.
Well, and just to clarify again, maybe Eileen or someone else can clarify this, but you certainly don't want every patient to enroll every prescription every time. That's just onerous and not needed. So adding the word dispense implies single prescription.
Hey, can I just interrupt for a minute? Moderator, there's someone that has a lot of background noise. Can you identify them and mute them?
Yes.
Thank you.
Albert, can I make a comment?
Sure.
I would like to see it, they have to get permission before not after the prescription is filled or first prescription. So it should be before. And also, how about those patients have only speak Chinese, Spanish, Russian? I mean, I want to make sure those patients understand what they're doing, how they go enroll and when and how they go disenroll. So, I mean, I would like to see them, they provide whatever language they speak and then provide the language in the flyer or notice to them.
I think that's already in there.
Yeah, I
Albert.
thought it was already in there.
Yeah, the pharmacy shall make available any written or electronic notification required by the section in alternate languages as required. So I think that's a great comment, but I think it's covered, hopefully.
Right.
Wait, I want to go back to Maria's comment because the last sentence, and I agree with you, Ryan. That's why I brought this up previously. But the last sentence of that paragraph says the patient or patient's agent shall enroll by written, online, electronic, informed consent. So I get what Ann's saying, to participate in the program for each prescription. So I think that they are enrolling, like every time they get a new prescription or a new drug. And I guess, so I have two comments, and that is for each prescription, do we really mean each prescription or for each medication? Because, sometimes in a year, you might have the same prescription for the same drug. And so are we really saying that they have to be re-enrolled every time they bring in a new prescription? But I also agree with what Ryan is saying and the comment from Lori that the paperwork or the notice is provided prior to dispensing the medication. So they're enrolled and the paperwork is all provided prior to dispensing. And I still think that's informed consent.
That is correct.
That's actually a great question. I think I would like to ask Eileen or Anne for each prescription component. So if it means each prescription, my understanding was if a patient gets, let's say, metformin and lisinopril, and they, maybe get one prescription without a refill, but if they enroll those prescriptions into it, that means a pharmacy and a patient gets a informed consent, that means a pharmacy have enough to be able to request a refill on those prescriptions for that. It's not that they have to get another consent when a doctor authorizes a refill on those same prescriptions. So if it says for each prescription, does that mean that they have to get informed consent for each time a doctor writes a prescription that is considered new technically in the computer system, but is not really new? Because if that's the case, then I'm a little concerned about this text.
Yeah, that's Sean. That's exactly my concern too.
So in the staff comments in response to some of the comments received, we talked about the prescription really are leveraging kind of the requirements of patient consultation where it speaks to a change in dosage or directions, those kinds of things. So I, at the staff level, don't believe that medication is appropriate. We felt that that was overly broad. Danny Rogers, who is actually the attorney working on this regulation, is on the line. Danny, would you mind speaking more to it, please?
Good morning, everyone. This is Danny Rogers. Yes, as Ann said, we are using the duty to consult language of the statute to signify in the response what prescription or medication would mean in this case. The only other option here to make it clearer is we could potentially add a definition stating what we mean by the term. That could be a potential clarification.
And I think that would probably solve the problem.
I didn't quite understand the solution. What was the solution?
To potentially add a definition to clarify what we mean by the term, so it's understood when the duty is triggered.
Okay.
So this is Anne. The only caution that I would say is we need to be careful if we're offering a definition that could conflict with other definitions within our statute.
Can we then have like an FAQ attached to this instead, so that it is more of just explaining what this is intended to do?
Or how about, in the response to the comment, and this is probably what the attorney wrote, it says, as with duty to consult, 16 CCR section 1707.2, if a new prescription is issued for medication already enrolled. So, I mean, what if we just what if we point to that, or maybe we call it for a new prescription as defined in 16 CCR section 1707.2. I mean, would that work?
Sounds like
Hi,
it.
this is Danny Rogers. I'm not sure if that would be precise enough. I would want a little bit of time offline to craft something in consultation with the executive officer. I think we could potentially use the, sorry, I'm getting onto my computer for the response so I can take a closer look at it. One moment.
While Danny's looking, I think I would say that the entire rulemaking expresses the board's policy and an FAQ to clarify it versus a cross-reference to the duty consult may be appropriate as well. We did contemplate that, and I believe that there were some potential concerns with cross-referencing the regulation into this regulation.
So you're recommending handling it with FAQs. Is that correct, Ann? Hello?
Yes, I think that is a path, and I think I heard another member suggest it, so.
Okay. All right, so where are we with Jig's motion here?
I think that was my motion, Greg. So.
Motion.
Oh, so.
Yes. So
Yeah. I have that Sung motioned, and I have that Ryan Brooks seconded the motion, but I wanted to clarify that for the record because I think Ryan seconded it, but then maybe spoke about it.
Okay, so the two of you need to agree.
Well, so I'm assuming the original motion was to extend the deadline for a year to start January 1, 2022, correct?
Correct.
All right. And now we're adding on to that motion to have in the FAQs a concise definition of dispense or medications, what defines medications. Is that correct?
That's what I heard.
That's correct.
All right.
Okay, so the motion and the second agree at this point. Great.
Hey, I
Thank
got
you.
I got a question.
Yes.
Song I on those automated refill program on number 2.
Oh, we can't hear you, Albert.
Yeah, speak into the mic.
Can you hear me now?
Yes.
Yeah, on number 2, it didn't say anything about the language. It just say that written or electronic note to summarize the program to patient or patient agent, but it didn't say anything about the native language.
Look at number 8. Look at number 8.
If you go down near the end, it's not on this screen, Albert, but it's on the next page.
As long as it's on there,
Yeah. Albert, if you look at number 8, it says the pharmacy shall make available any written or electronic notification required by this section in alternative language as required by state or federal law.
Okay.
It's number 8.
Yeah, okay. That's fine. Thank you.
Okay, so we now have a motion and a second. Do we have any additional member comments?
I just want to make a quick clarification, question to Debbie Ville. Is this the problem, Debbie, that we're trying to solve?
Is this what? Say that again, Ryan.
Does this solve the issue of having this word before dispensed?
I think number 2 and the way it starts off is a problem, but I said that last time, and I agree with what you're saying, but I don't think that the other board members agree with us.
But I think what Ryan's asking now is, does the issue handling the definition of FAQ resolve his question? And I think the answer is yes.
Well, so his question was about, so my question was for each prescription, and yes, I think that's fixed. But the beginning before patient enrolls, I don't think that the FAQ is resolving that.
Neither do I.
Okay, so do you want to deal with the motion that's there? Do you want to withdraw your second? How do you want to deal with it and issue a new motion?
Well, before I withdraw the motion, I would love to hear from the other members. That, I know where Debbie is on this issue. I'm trying to get this right the first time. And so if any other members have any strong objections to it, please speak now.
Okay.
From practical perspective, before makes sense. I'm not sure what the alternative language would be. Before someone is enrolled into a program, we have to give a patient an information about a program. I think the original word was when. So I'm not sure what alternative would be appropriate. It makes sense in practical perspective, but I'm not a lawyer, so I don't,
The speaker, I thought her solution was good. It's before a prescription is dispensed. So it's still before, and and then if you go on, it says the patient will be enrolled. So they still have to enroll. It's just the presenting of the paperwork has to happen before they actually get the prescription. And I'm thinking of, when you're working in the pharmacy, to enroll the person and have to stop everything, print the paperwork or send the information, have them read it, and then go back in and enroll them.
But the way that a lot of times these things work these days is that a pharmacy will text patient with this information, then they can just reply on the text before the patient is not even at the pharmacy. So I just think that the technological solutions could prevent any kind of delay in people getting their medication.
Okay, so I think you might be saying the same thing, because we're just saying that they get that information before they ever get the prescription. So, but they can't. But currently, they can't even be enrolled in the program until they have the information and they acknowledge. This is saying just at the point that they pick up their prescription, they have the information, they've enrolled. That happens before the prescription. So let's say we get the prescription from the doctor. Like, I went to the doctor yesterday. He emailed, he prescribed my prescription. So the pharmacy, sends me the text message. And so then I could make the decision. So it all happens before I get my prescription. So it's just, enrollment happens before the prescription's dispensed, or enrollment happens after all the paperwork has been received.
I agree with you, Debbie. This is Jig.
Yeah, it seems like, it sounds like it's a very practical change.
And I think it's still informed consent. I don't think we're taking away informed consent. I think we're just taking away exactly when it's when the paperwork has to hit the patient.
Hi, Debbie. Could you explain to me what is the practical problem as written right now? If before the farm, not before it's dispensed,
Before enrollment. Before enrollment.
Great. I'd like to make a point. Well,
wait. Let's let her respond to Jason first.
So it's so before enroll versus before the prescription. So it's when they receive the paperwork. So right now is before they enroll. It's like, what is the culmination point? Is it Is it enrollment, or is it that they have everything, the paperwork, they've agreed before the prescription is dispensed? So potentially, if they're electronic, might not be as big of a deal because they could stand there, like if they're standing in front of the pharmacy and you're asking the question, they could real quickly look at their phone, go through it, okay, I'm enrolled, you can enroll me now. Versus, I think what I'm trying to say is they can say, yeah, I'm interested, I send them the electronic information, they can enroll, and then they're enrolled before I dispense the medication. I mean, it's just the way the flow. I think it just it'll flow better for the patient and pharmacy by just making that slight change. In both cases, we're informing them before they're enrolling, and in both, and my thought, the prescription won't be dispensed until they're enrolled. The other way, they could actually get that first prescription and not be enrolled. That's really the difference.
The thing is, though, I mean, in most cases, the way that the workflow works is, it is rare that a patient will be enrolled into a program when they're actually expecting to get a prescription. They will get a prescription, then at the pharmacy, if it is a maintenance medication, a pharmacy usually will offer them if they want to enroll in this program.
Exactly, that's what I want.
That's exactly.
I mean, usually it's a maintenance drug. You want a automatic refill. It's not the first prescription, first written prescription. It's a maintenance drug. So
right, and
so it should be, we should have to, fill whatever prescription, and then you could ask them, and then if they enroll, and then that's fine. Then your next refill, then you can refill.
Well, that's
exactly.
why, let me tell you, what happened with me, I went in with a prescription. It was a maintenance prescription. It was the first time I was getting it. And they asked me while I was there, do you want to enroll in an automatic program? And I said yes, and it worked fine.
Yes.
So,
okay, but Greg, in this situation then, we could not have enrolled you at that point because we would have had to send you the information first, and then you would have to come back and say, yes, enroll me.
See, no, I don't think so.
That I'm proposing is the way it works for you is the way it should be worked.
Why can't they just receive that information at the counter? They read it. I mean, I don't think that this is complex.
Exactly.
That's what they did with me, exactly.
I mean, it's just a sentence describing the program, their rights, that they can disenroll at any time, that they are entitled to a refund. And that's that. I mean, it's just like people who receive prescriptions has these privacy notices that are extremely long. And in real world, I don't think anybody really reads it, but they sign it. So, I think it's just kind of, I think we're running in circles.
So I think what we're creating here is we have to give them the paperwork before they can even respond. And like you said, who's going to look at the paperwork, honestly?
Well,
but if they want to look at the paperwork, they should be able to look at it.
They have to know
the paperwork is stopping the flow. So how we currently have it is you have to give them, they have to either be given the paperwork, has to be on their phone before they can enroll.
I think that's the intention of this regulation, is because pharmacies have been enrolling people without them knowing what this program entails. A lot of times they push patients to enroll into these programs, and they get a refill of something, it gets shipped to them, their house, they didn't even know about it. So that's the idea behind this regulation.
Okay, well, you know what, whether we give them the paperwork before or after they enroll, that could still happen.
The best place to
get
it.
Giving the paperwork ahead versus what I'm saying, with a prescription, that's not going to, that if they're going to read the paperwork, it's just, I'm only saying when you give the paperwork. That's all my point is.
You can enroll the patient before the first prescription. I mean, the idea is, they have to understand what they're getting into. So
Okay, let's make a
I mean,
decision.
it seems like,
This is going-
nobody agrees, so I'm fine. I mean,
Yeah, this is
we've already
going in
argued.
circles. Let's
That's
just,
fine.
okay.
Hold on it.
Okay, so we have a motion, we have a second, unless Ryan doesn't want to do the second.
I'm still
Ryan,
good.
you're still good, okay.
You
Well,
please clarify
move
the
on.
motion. Please clarify the motion.
Yes, Sung, would you,
The motion is to adopt the language as recommended by the board staff and also to put, instruct a staff to develop an FAQ explaining and each term what each prescription means, and also the effective date shall not be before January 1st of 2022.
okay. And Ryan, you're good with that? That your second?
Go ahead, Debbie.
President,
Yes.
Who's that?
Now we're gonna have to go to public comment.
Go ahead, Ann.
What?
I'm sorry, Sung, just to clarify, your motion also includes accepting the recommendations offered by staff, not just the language, but the recommendations on the comments.
Yes, yes.
Thank you.
Thank you.
And what second? Was it second? This is Cheryl. I didn't hear. Was it second?
The second was Ryan,
Okay.
okay? All right, so do we have any other member comments before I open to public? No, okay. Shelley, let's open up the lines to public comment.
This is the moderator. I've opened the Q&A panel for submission of requests for public comment. If you would like to make a comment, please click on the Q&A icon at the bottom of your screen. Enter "I would like to make a comment" in the ask field, and then submit that to all panelists.
Now, these comments are specifically to the motion. No comments?
We've not received any at this point in time.
Okay, let's close it up.
It is closed.
Okay, let's move to a vote. Ricardo?
I vote yes.
Thank you. Maria?
Yes.
Thank you. Ryan?
Yes.
Thank you. Debbie?
Yes.
Thank you. Shirley?
Yes.
Thank you. Cheryl?
Yes.
Thank you. Jig?
Yes.
Thank you. Albert?
Yes.
Thank you. Sung?
Yes.
Thank you. Jason?
Yes.
Thank you. And I vote yes, and it passes. Now we're going to move on to item 10B. Okay, as included in the meeting materials, we will now consider the proposed regulations to amend Title 16 CCR Sections 1711 and 713 and add Title 16 CCR Section 1715.1. This is related to automated drug delivery systems. As with the prior agenda item, the board voted to amend the regulation language and release the language for a 15-day public comment period as part of the September board meeting. This comment period ended on October 10. There are several items included in the meeting materials, including comments received during the 15-day comment period, summaries of the comments received with recommendations, and the proposed text that was released for the 15-day comment period. I trust members have taken the opportunity to review all the meeting materials. As we begin our discussion, I would like members to provide your thoughts on the comments received and staff recommendations. As part of your comments, please offer a motion if appropriate. I note that a possible motion is provided in the meeting materials that would facilitate adoption of the language as noticed for the 15-day comment period. I'm now going to take a roll call of members for comments on this proposal. Maria Serpa. Do you have a
Hi.
comment? Yes.
I have no additional comments. I think that the proposed regulations have been discussed over a vast amount of time, and I believe that it meets our needs.
Okay, do you wish to make a motion?
Certainly. I move to accept the proposed regulations as written and to commence the regulatory process. Is that the correct motion?
And you accept the staff responses to all the questions?
Yes.
Thank
I'll
you.
second that.
Okay,
And
thank
do
you,
we also
Ricardo.
need to add that bit about making technical or non-substantive changes?
Council, do we need that?
Yes, I would
I would
recommend
suggest
that.
that you add that.
Okay.
Okay.
And just to clarify, I'm sorry, this is Noreen. Just to clarify, is the motion to adopt the
Yes.
modified text?
Yes, it is.
Okay, thank you.
Okay. So we have a motion, we have a
This is
second.
Anne. Greg, I apologize. For the record, would it be okay if I read a possible motion, Maria, and you can let me know if it captures what you're looking for? Accept the board staff recommended comment responses and adopt the language as noticed for a 15-day comment period. Additionally, delegate to the executive officer the authority to make technical or non-substantive changes as may be required by control agencies to complete the rulemaking file.
Yes, you took the words right out of my mouth. Thank you.
Sounds great.
No, that was supposed to be right out of Maria's mouth.
Yeah, that's true.
I agree.
Well,
Thank you.
at least it's out of some mouth. Thank you. Okay. So any additional comments from members? Not hearing any. Let's open up for public comment.
This is the moderator. I've opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon at the bottom of your screen. Enter "I would like to make a comment" in the Ask field and submit that to all panelists. Our first request comes from an individual named John Gray. John, your microphone is unmuted and you will have 2 minutes.
Thank you. Good morning, John Gray. I'm a registered pharmacist with Kaiser Permanente. I want to once again thank the board for its thorough review of our letter during the 45-day comment period. We do still have some concerns about the board's proposed changes to its quality assurance program requirements in the California Code of Regulations, section 1711F. In our letter during the 45-day comment period, we indicated that we believe that the requirement to submit quality assurance records to the board will be burdensome to the regulated public while providing questionable benefit to California consumers. We suggested that the board should only require disclosure of quality assurance records for licensed APDS devices. The board rejected that comment, citing the statutory requirement to report to the legislature on safety concerns related to the use of APDS devices. In our letter during the 15-day comment period, we laid out the ways in which we believe that the proposed modified text of 1711F is inconsistent with the stated intention of the author of SB 1447 to have a less stringent regulatory scheme for certain ADDS devices, and the legislature's intention in adding Business and Professions Code section 4427.8 to the bill. In our letter, we contended that the board has the statutory authority to collect quality assurance records only for certain types of ADDS devices, and taking that kind of targeted approach would be more consistent with the intent of the author and the legislature. Based on board staff response to our 15-day comment letter, we gather that the board intends to keep the proposed modified text of 1711F as it is written. It is disappointing that the board staff response to our 15-day comment letter simply directs us back to the September 2020 board meeting materials in which 45-day comment letters were reviewed. In my review of those materials, I found that there was no discussion related to our observations about the legislative history of SB 1447 and the actual reporting requirements placed on the board by 4427.8B3. Therefore, we would like to ask the board staff or the board can say anything more specific about the board's view on the issues that we raised in our 15-day comment letter. Thank you very much.
Thank you.
Our next request is from Paige Talley. Paige, I have
Yes.
unmuted your microphone.
Oh,
and
thank
you will
you.
have 2 minutes.
Thank you. It won't take long. I just would like to hear the motion again. I didn't quite get it all.
Okay. Anne, why don't you read it again?
accept the board staff recommended comment responses and adopt the regulation language as noticed for the 15-day comment on September 25th. Additionally, delegate to the executive officer the authority to make technical or non-substantive changes as may be required by the control agencies to complete the rulemaking file.
Thank you.
We have no further requests at this time. Would you like me to close the Q&A panel?
Yes, please.
It is closed.
Okay. Having a motion and a second, it's now time to vote. Albert?
Yes.
Thank you. Jason? Remember to unmute.
Yes.
Thank you. Debbie?
Yes.
Thank you. Maria?
Yes.
Thank you. Ricardo?
Yes.
Thank you. Jig?
Yes.
Thank you. Sun?
Yes.
Thank you. Shirley?
Yes.
Thank you. Cheryl?
Yes.
Thank you. Ryan?
Yes.
Thank you. And I'm yes. Motion passes. Okay, next item. Let's go on to item number 11, which is licensing committee. I will now turn the meeting over to Debbie Veal, the chairperson of the licensing committee, to give her report. Debbie, you're on.
Thank you, Greg.
Thank you.
In attachment 1 is the July 8th licensing committee meeting minutes. During the meeting, the committee did approve these draft minutes from our July meeting, and they're included for your reference. Let's see, so this is item B in our report. Discussion and consideration of a proposal to expand the authority of pharmacists to order and administer clear wave tests for influenza and COVID. As a committee, we had a super in-depth discussion on the current authority for pharmacists to perform clear wave tests under existing law and under the provisions of Dca Director's Waiver, and considered it the best interest of the consumer to expand the testing authority of the pharmacists. The minutes from the meeting were provided as a supplemental information and provided significant detail regarding the committee's discussion. I'm not going to go through all the details of the discussion because I am assuming that you have read the attached information, and you can see the very methodical way that we went through this discussion and really attacked, this proposal with a lot of input from stakeholders, which at our meeting this last week, we really appreciated the stakeholders being present. They provided significant amount of feedback and really added to our ability, I think, to bring to the full board some great information. So when you look at attachment 2, you will see the relevant law, you'll see the Dca waiver issued, and other relevant information. So with the the CDC noting that both flu and COVID-19 are respiratory illnesses caused by different viruses, coupled with the fact that it may be hard to tell the difference between the two based on the symptoms alone, testing may be needed to help confirm a diagnosis. And as we're entering into this flu season with COVID around, and rising, it seems appropriate to consider the benefits to the patient if the pharmacist has the authority, which we are proposing to expand, to allow them to perform clear wave point-of-care tests for both COVID and influenza. So the way we attack this is, because we first decided, okay, what's our policy? Do we believe this will benefit the patients to expand the pharmacist's authority to perform these tests? And there was agreement, I think unanimous, among the committee members as well as the stakeholders supporting the expansion. So with that, then we wanted to look at what are some specific things that we should consider. So if you looked in the minutes, you will see that there's basically 7 questions that we went through item by item, discussed as a board, discussed with the stakeholders, kind of came back as a board, discussed, and then moved on to create our recommendation at the end. And I'm just going to very quickly go through those items. It's one, if any, number one, what, if any, additional training requirements should be required? Number 2, should the proposal specify how test results should be communicated to the patient's PCP? Number 3, should the proposal specify either the space requirements or specify that a pharmacy must use physical barriers or other safeguards? Number 4, is it necessary to detail the PPE or the protective equipment required, personal protective equipment requirements? Number 5, should the board be notified in advance of a pharmacy providing such services? Number 6, should the board specify records requirements? And number 7, should the proposal include provisions that require pharmacists to provide patient education as part of the process? So as I mentioned, there's significant discussions on these 7 questions. And we used the information we gathered and the discussions from those 7 questions to pull together our proposal. So included in the supplemental meeting materials are 2 items for the board discussion that are being recommended by the committee. A policy statement that speaks to the board's support of efforts to expand such testing, as well as direct statutory language. When discussing the policy question, the committee determined the best approach was to allow flexibility to the pharmacist. This was in large due to the recognition that testing in some pharmacies may be done in a drive-through, while others it might be done in a dedicated space. As such, when I reviewed the provisions, many of the requirements are established through the required policies and procedures developed by pharmacies. The approach we are offering, we believe, balances the consumer and employee protections while also providing flexibility. I want to highlight a couple of the elements in our draft proposal. As drafted under the proposal, a pharmacist's scope of practice would be expanded to allow for a pharmacist to perform any aspects of the FDA-approved or authorized point-of-care test for COVID or flu that is classified as CLIA waived. If 1, the testing is done in an appropriately licensed pharmacy that is also licensed as a laboratory, and the 2, the pharmacist has completed the necessary training as required in that pharmacy's policies and procedures. The proposal also sets forth provisions that a pharmacy must meet. Number 1, they must be appropriately licensed as a lab. Number 2, they must maintain policies and procedures. And so as you'll hear, the policies and procedures we use as a way to answer a lot of the questions that I read before, because we felt like we wanted to give the pharmacies flexibility because there's a lot of different ways and physical plants that you could address these tests. So we thought in order to make, I guess you could say in order to keep access, that we wanted to protect the consumer and at the same time allow these to be used as often and as much as possible. So the policy and procedures in the minimum would provide several elements, including it would spell out the initial training requirements as well as ongoing training requirements. It would specify the safety precautions to protect pharmacy staff and consumers, to ensure a safe space for privacy, and to reduce the risk of contamination, as well as the requirement for providing test results and documentation for testing equipment, and provisions to ensure appropriate storage and handling of the specimens and reagents. The proposal requires the PIC to perform an annual review of the policies and procedures so they could, update or make any appropriate changes. Number 4, they also need to document the documentation requirement. We also are proposing changes to provision under the purview of the CDPH regulation that would also be necessary to meet the policy goal being recommended. So by providing both a policy and statutory language, what we're trying to do is policy will hopefully help the board obtain a waiver, quickly, so that, we will be able, the pharmacists will have expanded authority soon in order to do the influenza and COVID CLIA waivers, CLIA tests. But then also, secondarily, we also wanted to, provide draft statutory language so that long-term this would be more of a permanent solution or expansion of the pharmacist's duties. So with that, let me see if there's any committee members that would like to make a comment on anything I said, or if you think there's something that we need to embellish, or just any comments that you think would be appropriate this time. So the licensing committee members, if any of you would like to speak up, that would be great.
I'd like to make a comment, but I was not at the meeting, so I will wait and see if someone else from the committee who was in attendance at the time wants to make a comment.
Okay, thanks, Cheryl.
So, Debbie,
Albert?
I have two comments. First, I am happy that the proposed draft language does provide some protection for pharmacists, but I think we need to make sure that we do add, and we have to make sure that we add languages that ensure the complete protection, including use of PPE. And also we have to make sure that pharmacist has adequate support in providing these services. I cannot imagine a pharmacist working alone, running around performing these tests. I think that would be crazy, to say the least. So I think that's the important thing. Second, if we do move forward with this, I really think we need to have to add a treatment. Somehow we need to add that. It just sounds so silly that, yes, we're going to test them. And then what are we going to do? We're just going to send them to a doctor who's going to maybe test them anyway again? I mean, the way that medical system works nowadays, I doubt any physician will just say, oh, you got tested and I'll just give you a prescription. I think we need to make sure we can provide treatment. So that's my two comments.
And I think, can I just comment, Ann, I think we talked about treatment, and at this point, that's an add-on. That wasn't something that we could do as part of this this proposal or this statutory change at this point in time. Am I remembering that right? Because I think we addressed that during our committee meeting.
Yeah, the agenda item itself is the expansion for the testing provision, not necessarily the treatment. But I think, you could take these comments, Debbie, and look at it as a future agenda item.
Yep. And I think, Song, as you know from our very detailed discussion, and once again, please look at the meeting minutes, we talked a lot. We were very concerned about the protective the personal protective equipment of the pharmacist. There was also comments about, right now with COVID, what's available and how it's used might we and Wayne. So that's why we, as a committee, decided to make it just one of the policies.
Okay. I like.
Go ahead.
So let's continue with Albert or Jig or Jason. Do you guys have anything you want to add?
Yes, I have a couple of items. On the if this allow the pharmacist or the technician, if they refuse to do the testing, is there any consequence on them? And also, if they do the test and we make sure that they themselves test frequently, so they will not be positive without knowing it.
If you recall, this is just for pharmacists, so there's no technicians involved in this one. And I think that that's why the personal protection equipment piece is very important. And it is an important piece of the whole process.
Well, the question is that can the pharmacist refuse to do so?
Well, I don't know if that's the board's decision. I think that that's more of a decision between the pharmacist and their employer.
But could we have strong anti-retaliation protections for the pharmacist who refuses to work?
Not sure how that's going to protect the public, but
Well, this is Maria. I'm wondering, that concept is an interesting concept that probably could be discussed not as a part of this, because there are so many programs that are regulatorily appropriate as a choice. And, the question of, work relationships and requirements and that is kind of a bigger issue than just this issue. So I'm not sure if we can squish it in here.
Okay, can I make a comment?
Yes.
Or what, was it someone else from our committee that wanted? You said Albert, and was there someone else?
Yeah, it was actually unanimous.
Okay.
Moving this proposal forward was unanimous.
Okay. I'm just looking at the notes and hearing everything. I just feel that policy and procedures are not sufficient. We need standards in place to protect the pharmacists before a statute here. I mean, we're going into a second wave with COVID right now. My understanding is like 41 states and Puerto Rico, they have, more people hospitalized with COVID right now since last late September. I get emails every day of members in my chain stores that are that have come down with COVID. We have one store where 20 members of the store ended up with COVID. Just Monday, I attended a memorial for 12 of our members we've lost to COVID. Pharmacists should not be required to perform these tests with the adequate PPE. I just want to make sure that we have that in there with, because when I went to get the test, I'm fine with the drive-through, but unless they have the proper N95 mask and goggles, hazmat, that's what they have when you go other places. I think it's important when you have customers walking in a pharmacy that those customers and also our employees there be protected. Because at the end of the day, this is about public protection also. And I think that, I've even had one store that their business is down and they had to start cutting hours because customers were scared to come into the store because of COVID and wondering about people going in with COVID to the pharmacies. And I'm thinking, I like the idea of the drive-through, but unless there's going to be some area or some standards in place for a special area for the testing to be done, then I don't know. I feel that I agree with pretty much what you're saying, but I do believe that we should have standards.
This is Jake. I just wanted to say that absolutely the number of population that's getting COVID right now, and the numbers are increasing. We have to play a role as most accessible healthcare worker out there and be able to differentiate between whether this patient has flu or COVID and refer him to the physician, or, we can provide treatment right now, but we're going to talk about this and hopefully we'll be able to provide treatment. But this is taking step forward in the role our community pharmacists will play in helping the population that's looking for help, especially in our urban, very densely populated area where the facilities might be jam-packed if there's a surge in numbers with flu and COVID. So, and with the PPEs, the requirement, I agree with you, Cheryl, goggles, the face shield, and the N95 masks, including trainings to how to wear the mask properly, how to wear the face shield properly, all of those things would be required. But this point of care testing, the way the draft policy has been presented by Debbie's team and by staff, I think this is going to empower our pharmacists practicing in retail pharmacy and take it to the next level, the services they be provided to Californians today.
So my concern with that is it's policy and procedures that is required, but before we make such broad changes, I do feel like we need to have a better look at, is this really enough? I think we need to send this back to the committee just to discuss the draft policy, just because at the committee, we were not really able to look at this exact text of the proposal. And so I think before we come to some sort of conclusion, we need to take a better look. Is this text that is on all these proposal, is that enough? We need to better look at it. And especially we have a waiver in place, and I think this is rushing for something that may harm a lot of people that are working right now. So I'm a little concerned about that. So I do think that we need to I'm more than a motion to send this back to the committee. Have a better look at the policy proposal that developed so that we can have a better discussion of all the languages. It's a long document that very specific changes, and we're pursuing statutory changes. We need to have a clear and concise proposal that we're going to try to pursue statutorily.
We definitely have to look at how the COVID numbers are increasing and the role our pharmacists can play to help our communities. And I feel that consumer can really use these services as soon as possible.
I agree, but there is already a waiver out there that allows us to do this.
No, there's only a waiver that allows the COVID, not the influenza. So I think let's kind of go back to one of the things that we talked about in the committee meeting, and that is we're kind of going after a two-pronged process. And so I think, Song, maybe where you're going is prong number 2 we take back to the committee. So prong number 1 is let's continue. Let's if we can embrace the overall policy statement, then we can hopefully get an enhanced waiver so we can do both COVID and influenza testing. And then we can send the statutory part of it back to the committee to maybe look at a more permanent solution with some of the enhanced provisions that you've talked about. Because, I think at the committee, we absolutely embraced doing a policy and procedure solution versus trying to detail out those 7 questions that we went through. But, if we're having remorse about that as far as statutory, that's fine. But I think, for statutory purposes, let's send it back to the committee. But for policy, I would like to see it go forward. So in this cough and cold season, cough, cold, and COVID season, that we can move forward and, get at least a temporary waiver in place, to, as Jig said, so we can, help the consumers in California. And then in parallel, we can start working on statutorily, how to address it in a more permanent process. I mean,
I'm in agreement with that.
That's how we sort it out.
Absolutely. That sounds great to me.
Yeah, because I think for sure we need standards to protect pharmacists in this process.
And Cheryl, I want you to know that was absolutely something that we talked at great length about. We aren't trying to not protect the pharmacists. We're trying to absolutely protect the pharmacists as well as, help the consumers in the state of California. And I think Jig said it very well. I mean, we are the health professional that is most accessible, and so we're trying to, take a prominent role in responsibilities that, affords us.
Yeah, and my concern is only the pharmacy not being a hot box for COVID, with COVID patients walking in there, because we still have stores right now where customers, even though it's mandated to wear a mask, that they walk in without a mask, and employees are told not to say anything to them. And so all I'm saying now, you have a lot of COVID patients. You don't know if it's viral, if it's a flu virus or COVID, and these people are walking in the pharmacy with our seniors and all our other besides employees, other customers, and without a mask, and they coming in, like I said, I'm fine with the drive-through. I just really feel real strong about the standards that's needed to protect pharmacists and customers.
Yeah, I mean, unfortunately, the state and and many of the counties have required masks. So I'm not sure that there's a lot. If I mean, I haven't been in any store that they don't require it, but I believe you that there are people out there that won't require it of a person coming in. But I do think that the state has put in the appropriate provisions, and if individual pharmacies are choosing not to follow those, well, I don't know what to say. So I'm looking in at how we can modify the motion to remove. I think I think I just get rid of. I'm going to go with my motion and just get rid of the last sentence where it says draft statutory language. Would that still be okay?
If we can make a motion to make a draft policy statement to move forward.
I'm going to make a motion here real quick, Song, but I have one written up, but I'm just asking the executive officer her opinion if I can drop the last sentence of the draft motion that I have in front of me, and that would get rid of the statutory provision.
Debbie, I think because it was a committee motion, you probably need to vote down the committee motion and then start a new one. Sorry. But council's welcome to chime in and tell me where I'm wrong.
Okay, so I'll read you what the committee recommendation was. And so since it's a committee recommendation, it does not require a second. And it sounds like we probably need, possibly we'll take comments from the public, and then we will decide if we're going to pass it or not. And if we decide that we only want to not have the statutory piece, I think we honestly dropped the last sentence. Anyway, here's the motion from the recommendation which will serve as the motion from the committee. To move forward to expand the authority of the pharmacist providing COVID-19 and influenza point-of-care testing. To direct staff to work with Chairperson Veal to put together a proposal to require the pharmacy to have written policies and procedures that would address privacy and safety precautions, incorporate professional judgment of the pharmacist, safety of the staff, proper safety protection equipment, sanitation requirements, as well as taking into consideration Dca Waiver, CDPH, and CDC policies into consideration. The committee's initial intent is to immediately pursue a policy statement to seek a waiver through the proper channels, and then draft proposal statutory language for a permanent solution to bring forward to the board well, it says next week, so this is last week. So I mean, I think as you hear what I said, and you know, hopefully committee members, you can recall, we very strongly called out a lot of the concerns that were brought forward. But I don't know, are there any other member comments? And if not, then I'll open it up to the public.
Yeah, I would like to make a comment. This is Albert. The only thing I'm concerned is that the safety of the pharmacist. Can you guys hear me okay?
Yeah.
And you know, the pharmacies who choose to do the testing, you know, if they have the staff to do so, I'd be happy to see that happen. I agree with Jay said. You know, I think it's our profession. We should help out the pandemic, but you know, some pharmacists may not want to be do the testing. So I think if we could protect those people who refuse to do so, the pharmacy who choose to do so, they should find the staff who's willing to do so. I would like to see that happen. So I would like to see some kind of language on the draft to protect the pharmacists who refuse to do the test.
You know, I'd like to, I agree with what Albert is saying here, because when I get to hear pharmacists tell me about how they're overwhelmed since SB 493 with nicotine replacement, birth control, travel meds, now PrEP and PEP, and now we're going to into the flu season with the flu vaccine, and now adding COVID. I totally agree with Albert's recommendation.
Do any other board members have comments?
Yeah, this is Jason. I certainly want to emphasize my agreement with protecting the pharmacists and all customers at pharmacies, but I do want to caution that there is an urgency to this matter. Currently, COVID is obviously the big fear out there of contagion and its drastic effects, but the waiver would already allow for that. So pursuing more detailed discussion, I think, is important, but I just don't want to lose the fact that we are in an urgent state, and pharmacists are the most localized health professionals that people have access to.
I think that's why, Jason, we're trying to move forward with a draft policy statement, but not moving forward with statutory language proposal, and we're going to send that back to the committee for a thorough discussion.
So this is Maria, and I speak in support of the committee's original motion and agree with Jason, not only because of the urgency needs, but because of the issues that are being discussed are probably not pertaining to the specifics of the statutory plan. You know, whether a pharmacist participates in something that is regulatorily appropriate, and that includes, you know, working with physicians, you know, providing other types of clinical services. They're not required per se. They're in agreement with the patient, agreement with the place of work, and an agreement with the physicians who are working with them on these other clinical practices. So we don't put the kind of detail into the regulations that give pharmacist authorization. Authorization doesn't make it a requirement, it just authorizes it should the pharmacy and the pharmacist choose to do it. And so I'm concerned that these important issues that you're talking about may unnecessarily delay moving ahead with the statute. I'm not saying that they're not important issues, but I don't think that they play a part in where we want to go with the statute.
Thank you, Maria.
And I think that is true when you're talking about independent pharmacists, but not pharmacists that are working for someone.
But that's not the role of the board, to get in between employee-employer relationships. When I take a job to do what is being asked at that job. It may be compounding, it may be providing vaccines, but that's not part of the board's role to decide what is required at specific jobs.
What is the role of public protection? What we're talking about is public protection also.
I absolutely understand.
Hey, guys, are there any other comments, about this motion? I think we've heard a lot about the, concern of the employee pharmacists. Are there any other comments from board members?
Yes. What about those pharmacists who refuse to fill the birth control pill? And
Hey, Albert, we're talking about COVID and influenza.
what I'm saying is that they allow not to, refuse to fill those prescriptions. So I'm saying, I would like to give the pharmacist the option whether they want to do or not, but not being forced to do so.
Okay, we're going to move on from that to see if there's any other concerns. I think we've heard a lot about people being very concerned about the employee pharmacists. Are there any other comments on the motion? Okay, is there any public?
This is my question. Yes, we are. I know that this is an emergency, and I feel we should not sacrifice pharmacists' health and safety. And I think as a board, that is a concern for us. The state needs to step in and put into place at least some baseline standards. And I think you were talking about doing that with that being brought back to the committee. And so I just want to say that.
Yeah, I think what I just want to be clear, bringing the statutory, making this a more permanent solution and trying to draft statutory language, it is what it will become in the committee meeting. I'm not making any promises of what we'll vote for in the committee meeting, but that has been discussed, that we'll move forward with the policy and try to get a waiver enacted if that is appropriate, but first the proposal is for both pieces. It's for both the policy and the statutory.
Debbie, can you clarify process? If we move ahead with asking
if we move ahead with the motion,
just a moment. Let me finish the question because I think it's kind of a specific point. If we go ahead and moving on statute, wouldn't that language come back to the board for specific approval on what statute we want to move forward on?
That's actually a very good point. So either way, if we approve this motion, it's going to, move the policy forward, which will potentially, get a waiver in place for both COVID and influenza, and then the statutory language discussion would come back to the committee. So yes, that's a good point, Maria. We can approve this motion and get what I think everybody wants, honestly.
I'm
Which
a
I
little.
think was your point, right?
Can Anne clarify this, or Eileen? Is this correct? Because
because Song, we can't. This is only proposed statutory language. We don't have any. Okay, yes, Anne or Eileen.
we're not legislators, but I understand we're not legislators. but I mean, what I'm
Ann
asking.
or Eileen, can you please clarify?
Yeah, so I've shared my thoughts. I'm hopeful Eileen can jump on.
We're, if you
Really,
adopt
the
proposal,
question
we
is
have,
really about the statutory process and process, not the specifics of the language. I think we're confused as to if the board decides to propose statutory language, how does that work? And how often do we have a chance to review those drafts?
that would depend on, we did propose some statutory language with the proposal, so you could either send it back to the committee, you know, to take a look at again in light of the comments, and then it would come back to the board, and then we have to find a sponsor, and then the statutory language process starts. So it would come back to the board at different points during the legislative process.
This is Noreen. I agree with Eileen. It would come back to the board. I would, want the board to think about how confident you are in the language if you are going to direct staff to look for an author for a particular language, or at least the policy that you want to effectuate, and then allow the wordsmithing to happen based on that, at least initially.
And that's, I think, why I'm hoping that we can get this language back to the committee for the statutory proposal at least, because I just feel like this is rushed. I understand it is urgent, but this is a little too fast for, all the concerns that are voiced here. I think we need to really take a good look at it.
Debbie, apologize for jumping in again. Eileen or Noreen, based on Debbie's, the committee's recommendation, the motion, does the motion provide flexibility as written to allow for the policy to move forward with the statutory language going back to the committee?
I don't have her precise motion. I was trying to find it. It was,
Do you want me to read it again?
Yes, could you?
Yeah, that was my issue as well.
To move forward to expand the authority of the pharmacist providing COVID-19 and influenza point-of-care testing, to direct staff to work with Chairperson Veal to put together a proposal to require the pharmacy to have a written policy and procedure that would address privacy and safety precautions, incorporate professional judgment of the pharmacist, safety of the staff, proper safety protection equipment, sanitation requirements, as well as taking the Dca Waiver, CDPH, and CDC policies into consideration. The committee's initial intent is to immediately pursue a policy statement and support to seek a waiver through the proper channels and draft proposed statutory language for a permanent solution to bring forth to the board's next week. So once again, we were writing this last week.
Well, don't you mean the next meeting as far as bringing the statutory language back?
Sure.
Yes, that's what I think.
Yeah, you're not talking about bringing it to the board now. You're talking about once you have the language, you'll bring it back to the board. And I think that was the question that was being asked.
Right.
Yeah, to bring forth to the board at the next meeting.
Right.
At the next meeting. So I think as long as you have a licensing committee meeting before the next board meeting that you can consider this and get an agreement, then you can bring it to the next board meeting, or you could amend the motion, just to say to bring it back to the board once the proposal is adopted by the committee.
Right.
Okay, and I think this is a committee motion. In order to amend it, we'd have to vote this down and then change it, right?
I think that's, I'm sorry.
Correct.
President Lippy.
Correct.
All right, why don't we take some public comment?
Very good.
This is the moderator. I've opened the Q&A panel for submission of requests for public comment. If you would like to make a public comment, please click on the Q&A icon at the bottom of your screen, enter "I would like to make a comment" into the Ask field, and submit that to all panelists. Our first request for comment comes from Danny Martinez. Danny, your line is open. You will have 2 minutes.
Thank you. Danny Martinez with the California Pharmacists Association. I would humbly urge you guys to pass the committee motion as read initially. This is an issue that CPHA has been working on since April of this year in terms of getting this authority specifically for COVID testing given to pharmacists because we are the most accessible form of healthcare. Everything that was an issue leading up to the executive order that was issued in August that was considered an issue for permanent authority has been addressed in this proposal that has been given. So the big sticking points were the ability to be a laboratory under 1206.5 of the Business Professions Code. That's been addressed. Additionally, in order to have a CLIA certificate, you need a designated lab director, which the pharmacy was not allowed to become. This proposal changes that and adds laboratory director or adds pharmacist to laboratory director definition. In addition to everything that was issued in our letter to the licensing committee, everything that we asked for that was important, including the PPE portion. And for purposes of the board, the reason we said to not specifically require certain parts of or certain PPE is because of perceived shortages, and you don't want to, in the middle of a pandemic, stop testing because you don't have a specific type of PPE. So, and whether it's independent or chain or any other setting, pharmacists are absolutely apt to know what a PPE is appropriate. So I would ask you guys to please reconsider this and approve the motion as the committee gave and to move this forward. Thank you.
Our next commenter is Lindsay Gullahorn. Lindsay, your line is open. You'll have 2 minutes.
Thank you. Good morning, President Lippy, Vice President Beal, and board members. This is Lindsay Gullahorn with the California Retailers Association and the National Association of Chain Drugstores. Just want to note that we do support permanently expanding the authority for pharmacists to perform CLIA-waived COVID-19 and flu tests, and we greatly appreciated the opportunity last week to be part of the discussion and licensing committee. We thank Vice President Veal, licensing committee members, and board staff for crafting the proposed language, which largely does appear to protect patients and allow for increased access to COVID and flu tests. And we also agree that this is an urgent issue, and a waiver does need to be pursued now, especially as we enter the flu season and as COVID cases increase. I think we'd like clarification on just a couple of points, and I think what I assume is correct, but if we could get clarification on just a couple of things. First, the proposed language dealing with the policies and procedures, it appears workable to us. And we thank staff and the licensing committee for working on it. With respect to the policies and procedures to protect patients' physical space and privacy, we just like clarification that drive-through testing meets those requirements. And I know we talked about this in licensing committee, which is why I assume it does. But as many of you know, much of our testing is conducted via drive-through occurring in patients' cars. So we just like clarification to ensure that a car would meet the requirements in that section. We'd also like to ensure that the proposal extends to CLIA-waived point-of-care tests performed at mobile testing sites, as long as a pharmacy meets all the necessary existing mobile testing site requirements. So just a couple of points of clarification, but we do support the proposal and appreciate your work. Thank you.
Our next comment will come from Jassy Gruel, and I apologize if I've mispronounced your name. Your line is open. You will have 2 minutes.
That is okay. Good morning, Chair and board members. My name is Jazzy Graywall here on behalf of UFCW. UFCW represents pharmacists in the retail setting where pharmacies are typically located in the back of the store. That means patients potentially COVID-19 positive must walk the length of the store on their way to see the pharmacist for a test. We are not disagreeing with the need to perform more flu and COVID-19 tests in the state of emergency that we're in, but our pharmacist members want to ensure that testing is being done safely to protect patients, the pharmacy staff, and retail staff from potential exposure to COVID-19. If this additional testing duty is to be performed by a pharmacist and added to all their other duties, the board must first impose and have in place standards to ensure that the pharmacist is able to maintain safe patient care. We urge the committee to take the statutory language back to licensing committee to ensure protections are in place for pharmacists. Without specific standards in statute, pharmacists have no protections as policies and procedures can change. For example, for low volume pharmacies that typically only have one pharmacist on duty, the standard will have to address that there will be only one pharmacist to take, collect, process, interpret, and share the results of the test, on top of completing all their other responsibilities and maintaining patient care. A standard will need to anticipate this and address it through requiring additional staffing. The comprehensive and mandatory use of PPE as required in the healthcare setting and for en masse testing sites must be a baseline and prerequisite requirement above and beyond what is currently required at pharmacies. Our pharmacists' health and safety is first and foremost. And just as for such testing sites, there should be a special and isolated route to the pharmacy for those who believe they are COVID-19 positive to avoid affecting other workers and customers, similar to what is done with drive-through pharmacies. Permitting pharmacies to test for COVID will require a change in law. Given the risk of every retail pharmacy becoming a super spreader site, we believe this expert board must first address in guidances the issues we have
10
identified
seconds.
above so that the law enacted will have pandemic protection built in from the very beginning. Policies and procedures are not sufficient. Thank you for your time.
Our next comment comes from Lori Walmsley. Lori, your line is open. You will have 2 minutes.
Thank you, board members. Lori Walmsley on behalf of Walgreens. We also are in support of the board's proposal to seek a waiver to expand to the influenza testing as well as seek permanent statutory changes. Walgreens, for perspective, has administered over 1.6 million COVID tests in 49 states and Puerto Rico so far since the pandemic has begun, and are very interested in continuing to offer these services as a valuable service to the community. In addition to the questions that Ms. Gullahorn posed related to the location that testing can be performed, would like to clarify the role that other appropriately trained personnel may play in the testing process. Most of the testing is actually being performed by self-swab for the patient, so ensuring that other appropriately trained personnel can continue to assist in that test in those processes is extremely important and something that will help the pharmacist. Additionally, this proposal appears to only address CLIA waived tests and not some of the other types of COVID testing that is performed. Just want to ensure what the board's scope of this is. For reference, in addition to the CLIA waived point of care test for COVID-19, there is a additional test that is the test that is most prevalent in the community, where the patient performs a self-swab and the pharmacy actually acts as a collection site. So there's very little interaction actually with the pharmacy staff. So want to ensure what the intent of all of this is and ensure that this would not limit those types of activities as well. Thank you very much.
Our next comment comes from Stephen Gray.
I'm sorry, Stephen, and I'm sorry, board
okay.
members. It's Jason Weiss. Unfortunately, I do have to temporarily leave the meeting at this moment, but I will return. Thank you.
Thank you, Jason.
Stephen, your microphone is open. You will have 2 minutes.
Thank you very much. Can you hear me? I'm calling from a hotel room. I've been evacuated because of the fires. Can you hear me?
Yes, we can.
Thank you. I'm speaking on behalf of CSHP. We agree with any of the comments that were just expressed. CSHP is in favor of proceeding with a waiver for the COVID test and the flu tests because this is a healthcare emergency. We also share some of the concerns, but believe that this can be worked out with further in the committee and in the board if they're, with a little more thought. But we proceed going forward with the motion. In addition to that, I would like to comment on one aspect of the proposed statutory language that caused concern. It talks about it's not on the screen right now, but it talks about a pharmacy may employ a pharmacist to do these wave tests. That's the general statement. I would just like to point out that by saying that in the statute, there's an implication that pharmacists that are employed in other environments cannot. That's an implication of law interpretation. And pharmacists are employed by licensed healthcare clinics. They're employed certainly by hospitals. They're employed by medical offices and in other environments where they should be able to use their training, experience, and professionalism to also assist in these public health emergencies and situations. So I would like to be sure that the committee, the board, consider that language and make sure that it does not inhibit the pharmacist's ability to assist in other environments besides inside a licensed pharmacy. Thank you.
Our next comment comes from, and I apologize for the pronunciation of your name, Adamola R.A. Your line is open. You will have 2 minutes.
I appreciate that, and I just want to thank the board for bringing this matter up and discussing this. I do represent National Community Pharmacists Association, and basically want to echo the comments that have been put out from the public. This being an emergency and with the COVID cases going up, it is paramount that California pharmacists are able to offer this service to the public. They're well trained, understand what they're doing, and there should be some understanding as far as there are many examples out there at this point of community pharmacists running these tests and doing it well. And if those examples are, I don't feel like more examples are needed because I feel the committee has done a really good job with the proposed ruling that has been put up. The one question I do want to put out there is I'm not certain why this only authorizes pharmacists. So even if we don't want to include technicians, pharmacy interns could be trained and it should be allowed to do these tests as well. And the other thing I wanted to bring up was this does allow for influenza. The HHS guidance also allowed for RSV tests because these three have common symptoms and should be. So I just want to recommend the board to possibly amend to include RSV tests as well. And as far as pharmacies developing guidelines, a good reference just to put out there would be having them review the CDC guideline, which is specific for collecting and handling and testing clinical specimens from persons who have coronavirus disease or who they suspect has this disease. And then the last thing I wanted to bring up was the individual staff mandate.
10 seconds.
That was brought up. It's probably, I would recommend that, the pharmacies should have a staff member that could do this, but technically we should leave it up to the pharmacy as that is more of a business decision. So if the pharmacist cannot have that, have a member run the tests, then and it affects workflow, then obviously then they should just not do it, but that should be up to the pharmacy. So we don't necessarily need to mandate an individual staff, but it should be recommended. Thank you.
Our next comment comes from Paige Talley. Paige, your line is open. You will have 2 minutes.
Thank you. Paige Talley with California Council for the Advancement of Pharmacy. I just want to say that we do agree with the motion. However, we also agree with Albert Wong and Cheryl Butler's concerns for protecting pharmacists who are employee pharmacists. I have anecdotal information, but I won't go into that at this point. But I do think somehow in the statute there should be some protections, and I don't know how to do that. But hopefully we can work that out in committee. Thank you.
Our next comment comes from Mark Johnston. Mark, your line is open. You will have 2 minutes.
Thank you, Mark Johnston with CVS Health. CVS Health supports this initiative. Thank you very much, board. Just 2 points of hopefully conversation for the board. See, under the banner of CVS Pharmacies, we operate OmniCare pharmacies, including in California. OmniCare pharmacies service long-term care facilities, and the residents of long-term care facilities are often not mobile to go into a pharmacy. These long-term care facilities do desire that we send a pharmacist to conduct these tests to the facility. So I'm highly concerned with this being limited to activities of a pharmacist within a pharmacy. We certainly wouldn't want to make this population go to a pharmacy to get tested. Most of the conversation today is about limiting patients being in a pharmacy. And so it sounds counterintuitive to limit this to inside a pharmacy. And when we do go to these facilities, assuming we can, it certainly would be nice to be able to take a technician or a non-licensed personnel along to take care of some of the paperwork and record keeping. And I see that this activity is strictly limited to pharmacists. So, you know, in light of the conversation around pharmacists having to initiate immunizations and where can a tech and non-licensed personnel be involved, it would be great to get some clarity from the board as to, you know, where techs and non-licensed personnel could be involved with this activity. Thank you very much for this effort, board.
At this time, we have no additional requests for public comment. Would you like me to close the Q&A panel?
Yes, please. Thank you very much.
It is closed. I apologize. We did have one other person pop in just as it's Paige Talley. She has already commented once. Would you like me to open her up again?
No, I think we heard from her.
Okay, thank you.
Thank you. Okay. So I guess, should we call for the vote?
Before we do that, you had made a comment before we went into public comment that it sounded like you wanted us to turn this one down and you were going to bring back another one. Is that correct?
No, I think actually based on what the board members were talking about and the discussion we had with the attorneys and the executive officer, that's not necessary because whatever we do with statutory language is going to go back to the committee anyway and be brought back to the board. So I think, you know, people wanted to make sure they had a chance to take a swing at some of the statutory language. I think this motion already, you know, based on what I understood the attorneys and executive officers already in.
That's not what I was referring to was that you had said in your motion to bring it back to the board, to bring it to the board. And I think you were talking about bringing it back to the committee rather than bringing it to the board. And you had said at that point that you would have to turn this one down and come in with a new one. So has that changed?
So maybe I misunderstood what the attorney, at one point I did say that, but I thought the attorneys came back and said that, that we were going to do statutory language and bring that back at the next board meeting.
Okay, if you're okay with that, then let's just go with it. So,
all right, do you want to call the vote, Greg?
I'm ready to go for the vote. Somebody else was going to say something.
Could you just get some clarification? Are we voting on the motion that we are moving forward as is, and that means the statutory language will go to the committee for discussion?
Correct. So that's the motion, and prior to going to public, we had both attorneys and the executive officer agree that that's what this motion meant. Anne, Emily, or Noreen, if I'm misrepresenting what you said about 10 minutes ago, please speak up.
This is Anne. I think I need to defer to counsel because of the Open Meetings Act. It's really probably more their swim lane than mine.
So, attorneys, I mean, my understanding is you agreed that our draft motion, because I reread it for you, indicated that it would go back to the committee and be brought to the board at the next meeting.
Right, at the next time. I think your motion is broad enough to encompass that. It will move the policy statement forward and indicate the board is interested in pursuing a permanent policy, and then the language pursuant to the process will be going back to the board as you clarify at the committee.
Right, this is Noreen.
Right.
I agree with that, and I think the reference to bringing it to the board meant right now. I think that's maybe the confusion, is bringing it to this particular meeting. But the staff and is being directed to work with Chairperson Veal to work on the specific language and go through that process. That's how I understand it.
Correct. Okay, let's go for the vote then. Maria?
Yes.
Thank you. Debbie?
Yes.
Thank you. Cheryl?
Okay, so the policy will go, but statute will be later. Yes.
Yes, thank you. Shirley?
Yes.
Thank you. Ryan?
Second. Yes.
Thank you. Glad you got back. Albert?
Yes.
Thank you. Jason? Oh, Jason.
I think he's
He left. He left. Okay. Son.
Yes.
Thank you. Jig?
Yes.
Thank you. Ricardo?
Yes.
Thank you. I vote yes. Motion passes. Okay. Debbie, you want to complete your report?
Do we need to take a break? It's been 2 hours, or I'm happy to move on.
I plan to take a break. I thought your report was going to end pretty soon and that we would do it afterwards. But if you think it's going to go on.
I have a 10-minute break. I know I do.
All right, let's take a 10-minute break then. That's fine. Okay, please answer when I call your name. Ryan?
Here.
Thank you. Cheryl Butler? Okay. Cheryl, is that you?
Oh, I'm sorry. Yes, I'm here.
Thank you. Shirley?
Here.
Thank you. Sung?
Here.
Thank you. Jig?
Here.
Thank you. Ricardo?
Here.
Thank you. Maria?
Here.
Thank you. Debbie?
Here.
Thank you. Jason? Oh, he's gone. Albert? Albert? All right, he's not back yet, but we have our quorum. Let's go ahead. Debbie, you want to complete your report?
Yeah, and I have a couple more items, so I'm not sure I'm going to, have it done in the next 5 or 10 minutes, but we'll see.
That's okay.
Okay. Item number C is discussion and consideration of action taken by ACPE related to the California Health Sciences University loss of accreditation status. And I do want to point you to attachment 3, where you can see the ACPE correspondence as well as our regulation around this. This is really informational and relates to action taken by ACPE to withdraw the pre-accreditation status of California Health Sciences University. As indicated in the meeting material, ACPE determined that HSU's program was not sufficiently compliant with 3 of the 25 ACPE standards. And as such, consistent with ACPE policy, more time could not be granted for accreditation. According to information obtained by ACPE, California Health Science University is not allowed to admit any new students. However, existing students are allowed to continue their education through the school's what's called the Teach Out program. Any comments from the members? Hearing none, moderator, will you please open the lines to see if there's any public comments?
This is the moderator. I've opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon at the bottom of the screen. Enter I would like to make a comment in the ask field and submit that to all panelists. Seeing no requests, would you like me to close the panel?
Yes, please, moderator. Thank you. Okay, I'm going to move on to agenda item D, which is discussion consideration of development of mandatory reporting requirements for schools of pharmacy to notify the board of licensees engaged in academic dishonesty as part of student academics. So as a committee, we followed up on the discussion on the published research and presentation the board considered as part of its July 2020 meeting. As indicated in the meeting materials, students enrolled in a pharmacy school are required to complete introductory and advanced pharmacy practice experience. Such practice experience cannot be earned without an intern license. The committee considered if it is appropriate to establish a policy to require mandatory reporting of academic dishonesty, which would allow the board to determine if the activity is substantially related to the license, and if so, what, if any, action is appropriate. During the meeting, there appeared to be a general consensus among members that the action is necessary to ensure integrity is maintained. Comments from the public also appeared to be in general support of some action. The dean from Western University indicated that academic dishonesty is a problem and suggested that schools could provide, as part of its reporting to the board, when a student is no longer enrolled if it is as a result of academic dishonesty. As a committee, we discussed some different options, but decided the first step is that we needed to define academic dishonesty and identify different ways to report to the board. As a committee, we intended to continue to work with the staff to find solutions, which we will bring forth to the board for consideration at a future board meeting. Board members, any comments or thoughts? Hearing none, moderator.
Sounds like a reasonable approach to me.
Yeah, we were actually very happy to hear from the dean of at least that part of the solution, but we did feel very strongly that, and one of the main comments we heard was that we really needed to define what academic dishonesty is. So that does seem like a reasonable next step.
Great, thank you.
Moderator, can you open the lines for public comment?
This is the moderator. I've opened the Q&A panel for public comment. We're displaying instructions on the screen for your use. If you'd like to make a public comment, please click on the Q&A icon at the bottom of your screen. You can enter I would like to make a comment into the ask field and submit that to all panelists. We have a request for public comment from Stephen Gray. Stephen, your line is open. You have 2 minutes.
Well, thank you for the opportunity. I'd like to express to the board that CSHP, California Society of Health System Pharmacists, agrees with moving forward on this issue, that academic dishonesty is a predictor of later in professionalism problems with integrity problems with law violations, etc. I did send to the board, and I can send it again, the policy from the University of California, San Diego. With their permission. They have a major developed program and have had it for years on academic integrity and various levels of that. I think a little bit of a clarification on what Dan Robinson said was that the university, Western University, does take action less than expulsion called failure to proceed. So there may be a problem with a student that doesn't necessarily require them to leave the pharmacy school, but they may be held back or they may have to take a test over again. There are various levels. And so, including for plagiarism or something like that. People, when they hear plagiarism, they think, well, that's just an academic violation. Actually, it's a form of fraud where you're putting forth something that you're claiming is one thing and it is really not. And we see that fraud is a concern for the profession of pharmacy and all healthcare professions. And there's a lot of information about that. The other thing about UCSD's program is they put all actions taken when and concluded actions, not allegations, but conclusions that the university has come to where they take an action on academic integrity problems on the transcripts.
10 seconds.
And that information is available on the transcripts for the board for UCSD students at least, and maybe other UC systems. Thank you.
Thanks, Steve.
Seeing no additional requests for comment, would you like me to close the panel?
Yes, please. Thank you. Okay, now we're going to move on to agenda item E, which is discussion and consideration of the authorized duty of a pharmacy technician and possible expansion to allow the administration of influenza vaccinations by pharmacy technicians. And please note that in the attachments is not only the relevant law, but also APHA's training program, which is one of the possible training programs that we kind of circled around. I want to highlight that as agendized, this discussion is specific to the consideration of possible expansion of pharmacy technician duties to allow the administration of influenza vaccine by the pharmacy technicians. I want to bring this up because during the committee meeting, we received several comments about expanding the agenda item to additional vaccines, which under the Open Meetings Act, we can't do. So as indicated in the meeting materials, the pharmacists have the authority to independently initiate and administer vaccines, including the flu vaccine. And as part of the pandemic guidance, CDC notes that COVID-19 pandemic has caused healthcare providers to change how they operate to continue to provide essential services to patients. Ensuring immunization services are maintained or reinitiated is essential for protecting individuals and communities and reducing the burden of respiratory illness during the upcoming influenza season. Some states have either pursued authority or are currently pursuing emergency rules to allow pharmacy technicians to engage in vaccine administration. As an example, it is my understanding that Rhode Island appears to allow pharmacy technicians to be involved in the administration of adult immunizations in accordance with training requirements promulgated by the Department of Health. The regulation then provides that a technician, too, who has completed a recognized certificate training course on appropriate immunization administration technique and holds current basic CPR is permitted to administer the vaccine under the direct supervision and with the authorization of the immunizing pharmacist. It's my understanding that a pharmacy technician, too, in Rhode Island requires an individual to pass a national certification exam. Another example is Nevada, which in response to, excuse me, COVID-19 amended authority to authorize pharmacy technicians with appropriate training to administer immunizations under the direct supervision of the pharmacist. Nevada board adopted emergency regulations allowing pharmacies to meet the increased demand for vaccine services. And under their emergency rule, a technician can administer the immunizations by intranasal, intramuscular, or subcutaneous injection under the direct and immediate supervision of a pharmacist who has subscribed a written protocol established by a physician if the pharmacist has determined that the patient should be immunized. Under the emergency rule, the technician must complete at least 1 hour of training related to vaccines, immunization, and administration of immunizations. Further, pharmacy technicians must complete at least 1 hour of CE on an annual basis. So that I only bring those two up because those are two states and how they have addressed technicians administering vaccine. It was with this basic information that our committee discussed the possible expansion of the authorized duty to allow the pharmacy technician to administer flu vaccines. So I just want to be really clear here. The pharmacy technician would administer, which means that they would, take the insulin and, the influenza and inject it into the patient. All the other pieces of initiating a influenza vaccine would be done by the pharmacist. So the pharmacist would do the screening, pharmacist would make sure it was appropriate. It's only the administration of the influenza vaccine that we're talking about. We started our discussion with, once again, just like we did on the prior, on the pharmacist COVID and influenza testing. This one we did in a similar fashion. We first addressed the policy question, is there a benefit to the consumers in the state of California to expand the authority of the technician to administer flu vaccine? In general, the committee consensus seemed to be that such an expansion is a benefit to the California consumers if the service is provided under the direct supervision of pharmacy and there's a clear understanding of the process. So, what we heard from both the board members and the stakeholders, the community, the public, was that there needed to be clear supervision of the pharmacist. In addition, the committee members expressed support, and members of the public also spoke in support of such an expansion. Once again, please read the minutes, and you can see all the comments from the committee. At the end of the day, the committee, as before, it was unanimous to move forward with this program. And as we mentioned before, we dealt with how we would move forward by going through 8 questions. And the questions are, what additional training should be required as a precursor to expanding the authority as a possible task? Should continuing education be required, and if so, what is the appropriate hours and frequency? Should the proposed required certification require certification in basic life support? What, if any, additional documentation should be required? Are all routes of vaccine administration appropriate? Once again, we are talking about influenza vaccine only. Is it appropriate to allow pharmacy technicians to administer epinephrine, so like an EpiPen? Should the proposal be limited to only patients of certain age? And should the proposal include explicit language providing that the supervising pharmacist has delegated the administration function and that the supervising pharmacist reserves the right not to make such a delegation? Once again, the minutes really detail very thoroughly the discussion that was had, and the supplementary materials kind of provide additional color. So we are recommending 2 items to the board. A policy statement that speaks to the board's support of efforts to expand the authority of pharmacy technicians to administer flu vaccine under specific conditions, as well as draft statutory language. Before we consider the committee's motion specifically, I'd like to highlight some of the elements of the draft proposal. Under the proposal, a pharmacy technician would be authorized to administer, so once again, administer only a flu vaccine, once again, only the flu vaccine, if it is deemed appropriate and delegated by the supervising pharmacist, and only if certain conditions are met, which include the technician holds a current CPR certificate. The technician has completed specified training. And when we talked about training, the discussion was around the APHA immunization training for pharmacy technicians, as well as other similar training. 1 hour of CE or some sort of continuing education would be required every 2 years, which would align with what we have done in the past. Allow for administration of epinephrine if deemed appropriate by the supervising pharmacist. So once again, it's the EpiPen. Require documentation of the pharmacy technician administering the vaccine and that of the supervising pharmacist, so that we would know which technician administered the vaccine as well as which pharmacist deemed appropriate and delegated the administration. And also would be the pharmacist that would have initiated and reviewed the information prior. So the motion that the committee proposed is this: to recommend to the board to move forward immediately with a policy statement to pursue a waiver through DCA due to COVID-19 to allow for pharmacy technicians to administer influenza vaccinations. Once again, I want to point out we're only talking about flu vaccines. We are not agendized to talk about anything else. Going on with the motion. In addition, to pursue a permanent statutory change by proposing language to allow pharmacy technicians to administer influenza vaccinations. The committee would like to have a future discussion to expand the pharmacy technician administering vaccines that include the COVID vaccine. So that's our motion. The COVID vaccine came up because, well, we're probably going to have a COVID vaccine hopefully in early 2021, and there was quite a bit of requests by the public that while we're authorizing flu, they would like for us also, for in the future, to be also talking about COVID vaccine.
Debbie,
So,
go
board
ahead.
members, are there any comments on the motion?
Yeah, I just have a question. On the maintaining of the identification records, you don't indicate for how long. How long was it anticipated that those records should be kept?
It would be consistent with other record retention.
Okay.
Hi, this is Song. I have some
Typically, it's 3 years.
So I am always for advancing our profession and allowing us to do more, but of course we do have to consider what kind of consequences we're dealing with. And I think during the licensing committee hearing, a lot of stakeholders we heard from are from our corporate colleagues who, I understand that if we could achieve something at a cheaper labor using pharmacy technicians, I understand their motivations of trying to push for this. But if our objective and our goal is to really push for increase in flu vaccinations, and I can tell you, there are tens of thousands of pharmacists that would be more than willing to get a job and be able to provide this. So the point is that there's more than enough pharmacists out there that can actually provide this. So do we really need this is a question. And in addition, pharmacy technicians, I just don't believe have adequate education and basic trainings at this point, and we have to do a better evaluations and have a workforce analysis of some sort to figure out what's really going on in marketplace. I think, I'm here to bring the perspective of real world community pharmacy, and I can tell you that a direct supervision of pharmacy technician administering immunizations is, in my humble opinion, not going to actually help the pharmacists. If anything, it will cause even more stress for the pharmacist to be able to supervise a technician. So I just think that we do need to have a better consideration, deeper understanding of if this is really going to help us. And I understand those states, but the reason why California, I think, is moved a lot slower than other states is because we are the largest state. We have 40 million people here, and what we decide to do is so impactful for so many people. So I don't think that we need to rush into the conclusions that this is going to help the public. We need to protect the public, right? And I still hear, even from pharmacists administering vaccination, from so many people that they're sometimes worried about vaccine-related injuries. And I hear comments that, oh no, I received the vaccination and I'm afraid the pharmacist gave the vaccination too high on the arm. So we need to make sure we do not damage any reputation that we built a pharmacist providing immunizations. And I'm afraid that this could negatively affect what we've built so far as pharmacists immunizing. So I respectfully hope that we can send this back to the committee and have a more of a discussion as a whole for the entire industry.
Hi, this is Maria. I'd like to make a couple of comments. First of all, I am concerned about sending anything back when we have a sense of urgency, but I do understand the comments that were just made and the concerns. But I think we have to keep in mind that access and public health is important, and vaccinations are given currently in physician offices and clinics by medical assistants who have less pharmaceutical training and less training than many of our pharmacy technicians. True, all of them are responsible to be trained on how to administer vaccinations, but right now medical assistants who don't have any specific degree are providing these vaccinations out in the public. But my questions, I speak in support of this, but my questions are to the committee regarding some of the specifics in the regulation. And just to tighten it up and to clarify, the message I heard that, certainly this would be a pharmacy technician only administering a vaccine after a pharmacist has done the appropriate review, discussion with the patient, written the prescription or entered the prescription into their computer system, and then that's only the actual administration that's done by the technician. Perhaps that could be clarified in the regulation, because it does say if deemed appropriate and delegated by a supervising pharmacist. That may be a good point to put in the reference of where that pharmacist is given that authority and what's required by the pharmacist. Because it's important that it's not just the pharmacist giving authorization to a technician, but they're following a protocol, a procedure that has been given to them as an authority. The second point, I'm just going to list them all because then maybe you can address them more quickly. The second point is number 2, where it talks about the training program. I'm always concerned about when we list a specific organization, or if you want to list an organization as an example, but that it also include and others deemed appropriate by the board. Because as written in the meeting materials, it only lists one organization and then they become the only organization. I don't think that that's appropriate. And then lastly is probably just something that was overlooked. Number 4, which talks about the administration of epinephrine. In here, it says something different than Ms. Veal said regarding that the pharmacy technician may administer epinephrine. So if you could just clarify whether that's the technician or only the pharmacist. And then also, I would clarify the route because epinephrine can be given in many, many different routes. And I think you mean solely sub-Q or IM. We would hate for anybody to try to do anything IV or intracardiac or anything crazy like that. And so I apologize for the long comments, but I wanted to just get them all in. Thanks.
Thank you, Maria. Yes, definitely our intent, and we tried to to repeatedly say administration of influenza vaccine. That was the only thing that was tied to the technician. I take administration of epinephrine. That's a good comment. And I think once we get to the statutory language around the training, we will use similar language as we have used in the past. You know, we don't want to only embrace APHA because there's their training in the past. CPHA has done a fantastic job of bringing out other vehicles. So similar to what we've done in the past, we will have some sort of accredited process. But appreciate your comment because that is our intent.
Debbie, this is Jake. During our committee meeting, we did talk about if there is an emergency and if the technician has to administer EpiPen, and that would be muscular, then we usually give an Thai. So I thought that we did talk about if there's an emergency and the pharmacist is a little further away from where they are, then they can, in an emergency, administer using EpiPen.
Yeah, and I guess what I read through here, Jig, you're right. I said allow for administration of epinephrine, and I referenced the EpiPen if deemed appropriate by the supervising pharmacist. We probably just need to shake that out a little bit, because like you said, it was, under emergency, exactly how that would happen, we'd probably need to, whether it be via policy and procedure or whatever. But yes, I agree with your comments.
So that also brings me to another question. Like, I guess I need clarification from Ann. I brought this up during the committee as well. So what does direct supervision mean? Does that mean that as long as pharmacist is aware, a technician, the room maybe in the next door, not directly viewing the technician administering vaccination, is that acceptable? Is it acceptable a technician maybe at the front of the store giving a vaccination at the door, but the pharmacist is in the back? As long as pharmacist is aware of the vaccination providing, is that acceptable as direct supervision? I think those are deep concerns I have, because that doesn't seem to be a direct supervision, in my humble opinion.
And I agree with that some, because again, there seems to be a situation right here where here goes pharmacists taking on more responsibility, and as far as the training, it needs to be apples to apples comparison when training other professionals must receive. They are able to administer vaccine as compared to technicians. I think you can't compare what a technician does as other, when you talk about staff and offices that are doing vaccines. Our techs are trained to do the work that they do as far as filling the prescription. I don't think you can just think that a tech can do this job better than someone in some other office. And again, I see a pharmacist that's stressed again, taking on another responsibility that they can lose their life.
It seems to me that
Hey, can I just respond to that? Hey, Greg, can I respond to that real quick? I just want to clarify a couple things.
Go ahead.
So the pharmacist would only delegate to a specific technician if they were, if they felt it was appropriate. And that's why we kept saying, that it would only be delegated. The technician can only do it if a supervising pharmacist delegated it. If you have a concern about a technician, then the pharmacist would be able to choose not to delegate it. In regards to the training program, I don't know if you looked at what was in the meeting material, but APHA has technician training for immunization. So I understand your comment that maybe you don't want to compare it to the person who works in a doctor's office, but the APHA is very specific for technician administration, and it covers things like describe proper technique when drawing up and administering immunization, recognize commonly used vaccines and routes, distinguish proper needle length, identify proper documentation procedures, describe safety measures to avoid accidental needle sticks. And so that's all kind of the pre-learning. And then there's a live seminar part of these training programs where they demonstrate a successful technique when administering intramuscular and subcutaneous injections. They also have to demonstrate appropriate distraction techniques during the immunization administration, demonstrate the use of the universal precautions as they pertain to blood-borne pathogens, so how to make sure they're protecting themselves, and explain the procedures for managing a vaccine reaction emergency. So kind of going to what Jig was talking about, and the use of the EpiPen, how that would work. And once again, we would also require that they be CPR certified, so that that they would be able to also perform CPR. So I understand your viewpoint, Cheryl, but I think we are talking about a very specific and thorough training program that would be taken by these technicians. Okay. I'm sorry, Greg.
Actually, you answered my question.
Well, I'll just keep talking and talking. I'll answer everybody's question. Other board members, do you have any other comments?
I don't doubt you could do that.
I had a quick
Any other comments? And once again, this was unanimously approved by the committee. I know that Song now maybe has had a little bit of time to kind of rethink maybe some things, and he's bringing up some thoughts that he's had since. But in general, the committee, not in general, but specifically the committee did unanimously approve moving forward. So I think, so one of the items you brought up, Song, that I think it's worth having Eileen, Noreen detail is, what does supervising pharmacist mean? Does that mean, and I believe in the committee we talked about this, and I think it's in the meeting minutes, but I think it's, because you brought it up, I believe this would be a good time just to get it in the board minutes also. So Eileen, Noreen, could you let us know what supervising pharmacist, what that means? Okay, not both of you at once, as my mother would say.
This is Anne, just should it be helpful. Business and Professions Code Section 4023.5 defines what direct supervision and control is. I'm happy to read it if that would be helpful.
See, and I didn't pick on you, because before you always say, let's have the attorneys do it. So the one time I don't pick on you, you have the answer. Yes, please, would you please read it?
It says, for purposes of this chapter, direct supervision and control means that a pharmacist is on the premises at all times and is fully aware of all activities performed by either a pharmacy technician or intern pharmacist.
But it doesn't mean that they're watching every move they make.
No, can't do that.
Debbie? Debbie?
Yes, Albert.
Yeah, we were talking about, maybe they should have some kind of designated area for the vaccination, because as we talk about somebody doing the hallway, somebody doing the front, but I think on the procedure manual that we should have a certain designated area, so still under supervision of the pharmacist.
This is the moderator. I'm sorry to interrupt. Mr. Wong, in the future, can you just move a little closer to your microphone? It's a little difficult to hear you. We want to make sure the recording picks up what you're saying.
Albert, good point. I think actually Maria hit on this a little bit, and I'm not sure how we address it or if it's just assumed. But, when the pharmacist, the same rules and the same policy and procedure pertain to the technician, giving the vaccine as would apply to the pharmacist. So I believe that all, as important as it is covered already with, the pharmacist. Because remember, they're just delegating the administration. And so everything else, as far as the pharmacist providing vaccinations, would apply.
My concern would be the pharmacist, if there's a problem, the pharmacist being liable. And yet, you have a pharmacist that's busy, and that's why the tech is helping out. And so, but then there goes the problem with liability if the pharmacist is right there to see what the tech is doing.
Good point. That is why we, in the required documentation, we do require that it's indicated that the technician was the one administering, and then who was the pharmacist who delegating and was supervising.
So I'd like to echo Joe's concerns here with respect to liability. So who, if there are issues with the administration of the epi or the flu, the immunizations, who would be responsible then? Would it be the tech, or would it be the supervising pharmacist, or the PIC?
I feel like my understanding is the supervising pharmacist, which is why that deeply concerns me. I don't know how we would get around that if a pharmacist, and I mean, that eventually they're going to be pushed into doing this kind of stuff because they're, it's just financial understanding. I mean,
it is the same process.
Could Eileen or Noreen maybe answer that question?
I'm sorry, was that Sung? Could you repeat the question? I just want to make sure I understand.
The question was actually from Shirley.
Oh, from Shirley. Okay.
Question is, who would be responsible or liable for any issues arising for any issues from the immunization or the administration of the epinephrine? Would it be the pharmacist tech? Would it be the supervising pharmacist, or would it be the pharmacist in charge?
I think as always, that question would have to be answered based upon the facts of any particular situation. I don't know that we could say specifically this is the person who's responsible, because you don't know exactly.
I think that for me personally, it would be helpful to have that clarification here so that the supervising pharmacist or the pharmacist in charge could then decide whether or not they, in their determination, would deem it appropriate to have a pharmacy tech do this.
Well, maybe Noreen or Eileen can clarify, because this is a bigger issue of pharmacy law, and I think some of the non-pharmacists may be confused or not aware. That is always overseeing and responsible for the activities of any technician. So, it goes to the licensee, the pharmacist, is how I understand it. When it goes beyond the pharmacist to the PIC or to the pharmacy, that's a different situation. But a pharmacy, at this time, my understanding is pharmacy technicians do not practice independently. They're always under the supervision of a pharmacist.
It's helpful. Yeah, it's helpful. Sorry, this is Anne again. Business and Professions Code Section 4115A provides, I'm just going to read it. A pharmacy technician may perform packaging, manipulative, repetitive, or other non-discretionary tasks only while assisting and while under the direct supervision and control of a pharmacist. And then it proceeds to say, the pharmacist shall be responsible for the duties performed under his or her supervision by a technician.
See, that is deeply concerning. I mean, that means that a pharmacy technician who is trained for 6 hours at APH course, I mean, granted that may be sufficient, but I respectfully disagree that is absolutely insufficient compared to a pharmacist with 8 years of training. And not only that, I mean, there's experience as a pharmacy intern. That is something that can come into what a pharmacy technician would be through before they're allowed to do.
Song, you're coming in and out. At least it is for me.
It's breaking up quite a bit.
Yeah, you're breaking up. Is there anything you can do to get a stronger signal or?
Sorry. I was just saying.
Just try again because you were just we were getting like every other word, and in all fairness, we should at least get every word.
Thank you. Is it better at all?
Actually it is.
Okay. I was just saying that I think that is deeply concerning, that what Anne just said, because I mean, if we are comparing filling medications in a bottle, which is a pharmacy technician task, to giving a vaccination, and we're putting that responsibility on the shoulders of supervising pharmacists, I mean, that is deeply concerning, and I just don't think that they have adequate training to be able to vaccinate patients in that amount of training, compared to a pharmacist who's gone through the entire pharmacy school curriculum with years of pharmacy intern experience before they're most likely to, do this on their own. That is too much liability we're putting on pharmacists. And as I said, there's enough pharmacists. There's more than enough pharmacists who's going to be able to be hired by our corporate sponsors if they really care about vaccinating the public. There's more than enough pharmacists out there. So,
Hey guys, this is Ryan Brooks, a non-pharmacist. I'm a little confused in this conversation because when we talk about liability from what? What problem are we trying to solve by having a pharmacist versus a pharm tech administer a vaccination?
Pharmacy technician providing a vaccination and causing a vaccine-related injury, which is very possible.
So what type of vaccination injury would a pharm tech or anyone, what would that look like?
That could cause a permanent nerve damage on the arm, have a permanent pain problem on their arm and shoulder. That could not be fixed.
So what I'm hearing, you're saying the problem is if they injected in the wrong site, that could happen, or is that a issue of the vaccine itself?
No, that is the issue of the immunizing person's technique and understanding and knowledge.
The knowledge of where to inject it, or knowledge of the vaccine itself?
No, it's the injection technique.
All right.
So, yeah, I'm kind of going where Ryan is going because, are we saying that nurses aren't able to inject, medical assistants to go through a 6-month course? And I also just wanted to clarify, I think we need to look at the bigger issue too. Pharmacy technicians are doing more than just putting pills in a bottle that may be just in one location. Pharmacy technicians, this is a kind of a bigger issue about that too, are preparing chemotherapy. They're preparing parenteral nutrition. They're doing lots of things that they are trained and supervised for. And so I don't want, I appreciate the comments and I understand the comments, but I don't want to limit the functions and the capabilities of our pharmacy technicians to assist pharmacists in freeing them up to do the clinical judgment activities where we need pharmacists to be. We need them to be there with the judgment and deciding is the vaccine appropriate or not on actually giving it.
And I'm gonna go back to the kind of the goal of the Board of Pharmacy is by having a pharm tech, are we putting the public in danger? Are we doing a benefit to the public? My gut tells me out of a million vaccinations, there's could probably be a very low percentage where there's an issue because a pharm tech injected into the wrong site. I mean, I think this is a solution to create a solution in search of a problem. So.
No, you're right. We are actually going to help our public in general, where mass immunizations would be required, and we empower our pharmacy technicians to immunize. It's going to help the community a lot.
Overwhelmingly.
Absolutely.
Plus,
it's a great thing.
have you ever had an injection by an MD versus an injection by a medical assistant? I'll take the assistant any day.
Amen.
This is Noreen. I just want to quickly clarify what I had said earlier. I completely agree with Ms. Sotogren in her reading of 4115 that it does say the pharmacist shall be responsible for the duties performed by the tech. I was talking in response to what I understood the question to be about civil liability, and civil liability is always going to be looked at on a case-by-case basis. So that's what I thought the genesis of the question was, and that's what I was referring to.
I mean, I think the bottom line is I just don't think the supervising pharmacists should be forced to allow their technicians to do this due to a corporate pressure. That's all I'm really hoping to say. That's all it is, because a lot of things are pushed down to their responsibility when they don't feel comfortable. And that's the real world out there. And that's, I mean, I think, in a community pharmacy setting, I can tell you that's what's going on. So we need to make sure we do everything we can so that we don't put pharmacists in an awkward position, in a very uncomfortable position to do this.
That's a bit of a different issue. This is not addressing, that's an issue between the employer and employee. And if somebody is being forced to do something that they don't feel comfortable doing, then that's a problem they have to deal with their employer.
Hey, President Lippy, are we going to have public comment on this? So I think we've heard a lot of different views from the board.
Is there any other board comment that is maybe new? Like we've any additional comments? Okay, moderator, can you please open the lines for public comment?
This is the moderator. I've opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon at the bottom of your screen. Type "I would like to make a comment" in the Ask field and submit that to all panelists. Our first comment comes from Lindsay Gollahorn. Lindsay, your line is open. You will have 2 minutes.
Thank you. Good morning again, President Lippy and board members. This is Lindsay Gollahorn with CRA and NACDS, and we strongly support the proposal from Licensing Committee to pursue a waiver and statutory change to allow pharmacy technicians to administer flu vaccinations. And we do believe that this should be pursued as soon as possible. I know I'm preaching to the choir on this, but flu vaccinations really are more important now than ever this year due to COVID. And public awareness of the need to obtain flu shots has resulted in our members experiencing upticks in demand for vaccinations. Last week, I think the day after the licensing committee meeting, federal guidance was released that states that pharmacy technicians should be able to vaccinate. So we really do believe that this proposal to allow pharmacy techs to provide vaccines as we enter flu season will give pharmacists the ability to better plan, increase vaccine capacity, and better serve patients. And it will also allow pharmacists the opportunity to spend more time on clinical patient care activities, as board member Serpa alluded to. And as Vice President Veal mentioned earlier, this proposal does include the required education and training for pharmacy technicians to ensure patient safety, including CPR certification and a minimum of 6 hours of training. Pharmacy technicians, as you know, would only be permitted to administer vaccines under the supervision of a pharmacist. All of these requirements will ensure patient safety is not compromised. And I do want to point out that pharmacy technicians administering vaccines has been demonstrated to be safe in other states where this authorization exists. And I know that this is not what we're discussing right now, but I also want to briefly note that we believe pharmacy technicians should be able to administer all vaccines, including COVID, once it becomes available. The federal HHS guidance that was released last week is consistent with this assertion, stating that pharmacy technicians should be able to administer all vaccines. So we do look forward to discussing this expansion further at a future meeting. But for today, we'd like to just signal our strong support for the draft proposal before you, and we look forward to working with you. Thank you.
Thank you, Lindsay.
Our next comment is from Shane DeSell. Shane, your line is open. You will have 2 minutes.
Thank you. Shane DeSale, Professor of Pharmacy at Touro University, California, and Chief Editor of the research journal, Research in Social Administrative Pharmacy. I very much in support of this measure. As mentioned, DHHS has come down with a ruling indicating technicians can safely administer flu vaccines for children aged 3 to 18, as well as an impending COVID vaccine. And this is due to the evidence, as the speaker before me just mentioned. There has been peer-reviewed studies published from Idaho, Washington, and other states that thus far there have been tens of thousands of immunizations administered, and now it's up to well over 100,000 in those 2 states alone, without a single incident of problem, as reported from pharmacists, and pharmacy technicians. So in actuality, even though there may be some pharmacists who may be resistant to this, there have been studies. There have not been studies in California specifically, but there have been nationwide studies that have been reported in the likes of AJHP, JAFA, and other research journals that pharmacists actually on the whole do embrace technician immunization, as well as expansion of the scope of practice of technicians in other areas, because they believe that in terms of expanding technician scope of practice, it actually improves patient safety, because it does allow pharmacists to concentrate on things such as mitigation of adverse events, errors, and other things to that nature that are best left up to the cognitive judgment of pharmacists. So in summary, all of the peer-reviewed evidence that has been reported in very high-rated, highly regarded peer-reviewed journals all point in favor of this measure.
Thank you.
Our next comment comes from Adamola Are. Your line is open. You have 2 minutes.
Thank you for giving me the opportunity to comment, but I will choose not to. I feel like what needs to be said has been said. Thank you.
Thank you. Our next comment comes from Keith Yoshizuka. And your line is open. You will have 2 minutes.
Thank you very much. Keith Yoshizuka, as an individual, I'm speaking in support of the allowing pharmacy technicians to give the vaccinations for the training for the pharmacy students. The majority of that training is didactic, not practical. And what the regulation at issue is discussing is strictly allowing the technicians to do the mechanical aspect of it, not any decision-making, which would be reserved for the pharmacist. As to the issue of supervision, I believe the existing standard in community pharmacy for direct supervision is line of sight. So the scenario painted earlier where the person is in the other side of the store would not exist, because there would have to be line of sight supervision. Thank you very much.
Thank you.
Our next comment comes from Jessica Langley. Jessica, your line is open and you will have 2 minutes.
Thank you very much, and thank you to members of the board for allowing for public comment today. My name is Jessica Langley. I am the Executive Director of Education and Advocacy for the National Health Career Association that offers the EXCPT National Certification for Pharmacy Technicians, amongst other training and learning resources available for and to support technician education and growth. I am speaking today on behalf of a newly developed group called the Coalition for the Advancement of Pharmacy Technician Practice. Hopefully you've had an opportunity to read our support letter. I will not reiterate what is in that, but on behalf of the coalition, which is made up of a great deal of industry stakeholders ranging from retail pharmacies, independent pharmacies, pharmacy educator groups, researchers, pharmacy publishing groups, and others coming together to have a more unified voice in support of advancing the practice of pharmacy technician practice. We highly support the proposal before you, and alongside having experience in the pharmacy technician space, the National Health Career Association works also very closely with the Medical Board of California. As mentioned, medical assistants are unlicensed in the state of California and routinely perform immunizations under the direct delegative authority of their providers, which would be the similar situation that we're discussing today, being that it's only the technical task being performed by technicians. As Dr. DeSalle also mentioned, there's multiple national level research and evidence that provides documentation of practice of technicians performing this across the country with little to no adverse effects. And we certainly also want to include that in further discussion. We will like to support the availability of technicians to perform all vaccinations moving forward. Thank you.
Thank you.
Our next comment comes from Paige Talley. Paige, your line is open and you will have 2 minutes.
Thank you, moderator. Hello, or good afternoon, Chairman Veal and President Lippy and the rest of the board members. I do have a couple comments to make. Chairman Veal, you asked me last week if my board would change their opposition on having techs do vaccinations, and they reluctantly are not opposing it. However, they are concerned about the use of techs doing epinephrine. And if you're going to just do an EpiPen even, those prevent acute attacks. And it could be something that requires a 911 call. And the way it was explained last week, techs didn't necessarily, so whoever it was that spoke from the board staff said that techs didn't need to be in eyesight of the pharmacist supervising them. So that's still of concern, because the pharmacist would have to say, yes, they're having an anaphylactic attack and need to give them the epinephrine, and maybe even an antihistamine. I can't pronounce the word that is in AB 1710, but I know it's Benadryl, and it helps to block an allergic reaction. So those are things that they're still concerned about and would like to have the pharmacist do that. And we want to make sure that the pharmacist is actually in view of the patient while they're getting the vaccination and the tech. And from anecdotal
seconds.
All right. I just haven't seen that when I've had vaccinations and my son in chain stores.
Time is up.
Thank you.
Our next comment comes from Stephanie. Stephanie, your line is open. You will have 2 minutes.
Hi. I am a dual licensed pharmacy tech in the state of California and Nevada. I just wanted to share that I'm able to license over here in Nevada, and I believe that it's extremely helpful for our pharmacists who have consultations and are checking off waiters to be able to help them and jump in to help out our patients so they don't have to wait very long, and also make sure that our patients are helped in a timely and safe manner. So I believe it would be extremely great for California to allow techs to immunize. Thank you.
Thanks, Stephanie.
Our next comment comes from Danny Martinez. Danny, your line is open and you will have 2 minutes.
Thank you. Danny Martinez with the California Pharmacists Association. So in the packet, we sent our letter to the committee with a supporting concept kind of position. We did pass a new policy at our last House of Delegates meeting supportive of the ability for pharmacists to administer vaccines under the supervision of a pharmacist. And as we're reading this proposal, there are some minor issues that we would like to address. Most of them have already been addressed. On the language regarding immunization, the training programs, the reason that we had specifically said in our letter to complete immunization programs that were endorsed by the CDC or ACPE was because that's currently what's in law, and we want to remain consistent with that language as it pertains to the training for technicians. On the issue of the CE, we did suggest that the pharmacy tech obtain 1 hour CE. However, there was a question that arose after the meeting in our membership of, because the fact that technicians are not currently required to obtain CE, how would this currently be enforced if they don't obtain CE? You know, there's a question of who's liable there, and I know that there was a question of whether it's the supervising pharmacist, the tech themselves, the PIC. We would probably need that clarification in here. On the issue of epinephrine, although that it is considered a simple task, there is clinical judgment involved, and we believe that probably should stay with the pharmacist for now. We can certainly discuss that issue. I don't know that we discussed that issue a lot during the committee meeting, but in terms of providing that authority, I think that should stay out at this point.
10 seconds.
And then finally, the responsibility of the technician. Again, if they don't follow what's in the regulation, what kind of punishment would they face? Well, that probably needs to be in there as well. Thank you.
Our next comment comes from Jazzy Graywall. And Jazzy, your line is open and you will have 2 minutes.
Thank you. Jazzy Graywall here on behalf of EFCW. Respectfully, given the stakes here, the board simply does not currently have enough information to render a decision on whether to allow for a dramatic and substantial change to the scope of practice for pharmacy technicians to facilitate flu or other vaccines. Yes, we are in a state of emergency, but pharmacists already provide this service, and there's no shortage of pharmacists who would be willing to step up and perform these duties. Some of the things that we think the board needs to render an informed decision are: 1, there needs to be an apples to apples comparison done in California of what training other medical professions must receive before they're able to administer a vaccine as compared to a technician. Are the current trainings in California sufficient for pharmacy technicians to perform this additional duty? The board doesn't know today, and we believe respectfully it needs to know and share a report with the current board members and the public. 2, there is a need for a workforce analysis to better understand if pharmacists even have the ability to additionally supervise pharmacy technicians administering vaccines. We just discussed the need for pharmacists to take on the duties to test for COVID-19 and the flu. Now we're discussing having pharmacists engage in the role of supervising an additional new duty. A workforce analysis will allow us to better understand the current role of pharmacists in different settings and with different staffing arrangements to be able to include additional duties without impacting patient care, particularly in the low volume retail pharmacies that are chronically understaffed. For these reasons, we believe the board does not have enough information at this time to push for a significant change to the pharmacy technician's scope of practice in the context of a pandemic. The old adage, do no harm, applies here. Lastly, pharmacists with strict anti-retaliation protections should have the ability to reject the additional supervisory role of a brand
10
new
seconds.
pharmacy technicians, since it is ultimately their license on the line. Instead of tying liability to the supervising pharmacist, we should hold the pharmacy itself accountable for these services. Thank you.
Thanks.
Our next comment comes from Alexandria Oaks. Alexandria, your line is open. You will have 2 minutes. Alexandria, can you hear us? I believe she just lost her audio signal. I will keep an eye out for her and come back to her if it pops back in. In the meantime, we will move on to Lori Walmsley. Lori, your line is open. You will have 2 minutes.
Thank you. Lori Wamsley on behalf of Walgreens. We also stand in support of this motion and ask that the board continue discussions to expand to non-flu vaccines. As some of the other speakers have mentioned, many of the other states that have already adopted similar regulations have seen very good successes in increasing immunization rates in those states. So we believe that this is an opportunity to enhance patient safety, to increase access to vaccines. This has been shown and proven to be safe through independent peer-reviewed studies. The Idaho Board of Pharmacy, who was the first board in the United States to adopt this, actually has been on record and in several of the articles that says that they've not received one single patient safety complaint in the 4 years that since they've adopted this new policy. So I do believe that this is safe. I don't believe that this is a dramatic change from policy. I do think that this is safe, and this is something also that the federal government is supporting as an effort to increase vaccination rates as a result of COVID. Thank you very much.
Thank you.
Our next comment comes from Rob Geddes. Rob, your line is open. You'll have 2 minutes.
Thank you very much. Rob Geddes, representing Albertsons Companies. We have several different banners within the state. Most likely you're aware of Safeway and Albertsons as a whole. I want to stand and thank you for the discussion that's been had so far and for the step that you're taking to increase the ability of pharmacy to respond to the pandemic at this point, and specifically with flu vaccinations. Albertsons Companies has been a leader in technician immunizations from the very beginning, based out of Idaho. So we were able to run the pilot initially back in 2016 that kicked off the whole discussion of technicians being able to be trained adequately to provide immunizations. I'd like to just point out that in the 4 years that we've been involved in this process, we've had tremendous success. Would echo the comments that we've yet to have a patient safety concern arise from the technician administering the vaccine. The training that's been provided originally from Washington State University and then subsequently through APHA has been very great training to prepare our technicians to be able to appropriately administer with good technique the vaccines to avoid any of the safety concerns or vaccine injury concerns that have been brought up today. We have definitely seen vaccination rates improve. Idaho has benefited directly from this, and I would expect that the 40 million population from California would benefit tremendously from having an additional helping hand to be able to administer these vaccines for flu, and hopefully in the future to expand that to be both for COVID and additional vaccines. But in general, Albertsons is in strong support of this initiative and applauds the Board of Pharmacy for taking the steps necessary to allow technicians to administer immunizations. Thank you very much.
Thank you.
Our next comment comes from Mark Johnston. Mark, your line is open. You'll have 2 minutes.
Thank you, Board. Mark Johnston, CBS Health. The safety research and evidence that was mentioned earlier today, it is overwhelming, and I have provided Ann with many of those publications. I did want to mention that Rob Geddes just mentioned Albertsons' great work in Idaho. I was the executive director of the Idaho board. I still reside in Idaho. And there were just as many independents that participated in that original program prior to the rule becoming effective to give the board safety data. This was not just a chain effort, I want to point out. I did want to mention the elephant in the room. With the current ratios in California, it certainly would be nice and would have this effort be much more utilized if there could be a concurrent ratio increase for immunizing technicians. It's really hard for the one-to-one technician who's counting and pouring to also be the immunizing technician. And lastly, I wanted to point out last week's HHS guidance. This guidance does preempt state law. It does allow technicians to immunize children from the age of 3 to 18 for childhood immunizations, for influenza, for COVID. It does allow technicians to immunize adults for COVID. Technicians will be immunizing in your state. However, it will expire when the emergency period expires, so this permanent maneuver by the board here is certainly needed. And the federal guidance falls short of one category, and that's the category that you're immediately addressing, hopefully in emergency fashion, and that's influenza for adults. According to the HHS guidance, technicians will not be able to give influenza immunization to adults.
10
so
seconds.
That highlights the board's great work here today. Thank you very much. We are in support.
Thank you.
Our next comment comes from Jason Kane. Jason, your line is open. You have 2 minutes.
Hello, my name is Jason Kane. I'm a current pharmacist working in pharmacy in California and Nevada. I understand a lot of concerns about the safety and some of the concerns about the technicians or the pharmacists having enough time to supervise technicians. But anything that will increase our ability and our maneuverability to help patients would be greatly appreciated. Anything that will help us do our job safer and be able to be one more tool and able to get people immunized. I feel like a lot of the times we don't have time to immunize the 30, 40 people that might be coming in to do it. Or not just the time, they don't want to wait the time it takes. So if I have another set of hands to actually help that patient that wants to be immunized, they will only have to wait maybe 10 minutes, 5 minutes, and they'll do that kind of wait, but they won't do the half-an-hour wait that might be there. So a lot of it is going to be the ability to get more and more people immunized. And I think that's part of the big safety focus that as a pharmacist, that we should be really kind of focusing on. And in my 19 years of being a pharmacist, I've never had the use of an EpiPen, so I've never actually had to use one. I'm lucky on one right now, but that's never actually occurred in my pharmacy. But if it did, we have plenty of EpiPens, so even a technician would easily be able to train on being able to do something like that. And that was my time. Thank you.
And our next comment comes from Danielle Tran. Danielle, your line is open. You'll have 2 minutes.
Thank you for this opportunity for me to make comments. I am totally in support of having technicians immunize in the community pharmacy. As a pharmacist myself for 32 years, I value our profession, and we are there to help when comes time of needs, and we are in a pandemic. We need to make sure that we are equipped to be part of the frontliners. Having a pharmacy in a community will make that a little more accessible to the community, to the community to be able to get the vaccine within timely manner. Accessibility is what draw people into the pharmacy and get it immunized. And I do believe that with the proper training, a technician going through classes and certified, and with the supervising of the pharmacist, a qualified technician will be a big help in the workflow of the community pharmacy, especially during these difficult times that we are facing. So I am totally approve of having technician immunized in my pharmacy. Thank you.
Thank you.
At this time, we have no additional requests for public comment. I see that the request for public comment, Alexandria Oaks, is still pending. She has not yet been able to restore her audio connection at this time. Would you like me to close the Q&A feature?
Yes, please. Thank you very much for your help.
Thank you.
Board President Lippy, what I'd like to do is read the motion and then one last time, because there's been a lot of time that has gone by, just to make sure everybody understands, because we've had a lot of discussion. And then have you call for the vote? Would that work out?
I agree. Thank you.
Okay, the motion, once again, presented to you from unanimous decision of the committee, is to recommend to the board to move forward immediately with a policy statement to pursue a waiver through DCA due to COVID-19 to allow pharmacy technicians to administer influenza vaccinations. In addition, to pursue a permanent statutory change by proposing language to allow pharmacy technicians to administer influenza vaccinations. The committee would like to have a future discussion to expand pharmacy technician administering vaccines that would include COVID-19 vaccine.
Okay. I will now take a vote. I'll start with Ricardo. Please remember to unmute.
Yeah, I vote yes.
Thank you. Maria.
Yes.
Thank you. Ryan.
Yes.
Thank you. Debbie.
Yes.
Thank you. Shirley.
Yes.
Thank you. Cheryl.
No.
No? Okay.
No.
Jig. Thank you, Cheryl. Jig.
Yes.
Thank you. Albert.
Yes.
Thank you. Sung.
I'm going to vote no on this one.
Thank you. Jason. Is
Jason has
back?
not yet returned.
Yeah, he hasn't returned. Okay. Okay. Yeah, I thought he was coming back. Anyway, I vote yes.
President
Okay,
Lippy,
measure
this-
passes.
this is the moderator. We did have one other public commenter that slipped through the cracks. Would you like me to open it for him for a moment?
Sure.
Okay, that's
Go
going to be
ahead.
Stephen Gray.
Okay.
Stephen, your line is open. You will have 10 minutes.
Thank you very much for the opportunity, and thank you, Greg, for the accommodation. I want to speak on behalf of CSHP. We strongly support this. We believe that it's an urgent matter, and I believe it should go forward. It should go forward rapidly, and it should go forward, as the discussion said, to include all vaccines eventually. And I want to speak very quickly as a pharmacist, as an attorney, as a professor of pharmacy law. I get a lot of questions about the liability. Counsel was correct in that there are different types of liability. Civil liability for all employees is ultimately up to the employer. Everybody can be sued, but in California, it's the employer that traditionally and practically bears the brunt. Also, individuals can be, but if they fall dead as the facts show that they did what was responsible and appropriate, they're not going to have a significant civil liability. As far as administrative liability regarding the license of the technician, the license of the pharmacist, or the license of the pharmacy, that is up to the Board of Pharmacy. And they will investigate the facts. And if the technician did not follow procedure, et cetera, then there could be and would be administrative liability, but all the way up the chain: supervising pharmacist, PIC, and permit holder. But in summary, we strongly support this. It is a national emergency. It is urgent. And this year, some major organizations are trying to get upwards of 80% of the population immunized by flu. It ranges between 40 and 50 per year. So this is needed more than ever to make sure that our hospitals can handle COVID and other emergencies and not be overwhelmed by flu emergencies. Kaiser Permanente, for an example, which usually does everything internally, is having memberships, 9 million members possibly go to chain drugstores and community pharmacies to get their vaccine this year. It is so urgent. Thank you.
Thank you, Steve. Okay, the measure passes. Debbie, it's back to you.
Okay, this is agenda item F in the licensing committee report. Discussion, consideration of pharmacy technician application requirements and common deficiencies. There's various pathways for our pharmacy technicians to get licensed. In the past, the board has undertaken efforts to reduce deficiency rates for such applications, including development of a video on the application process. The most common deficiencies are the application itself is not complete, such as the application is not signed, dated, information is not complete on the form. The self-query report is not received in a sealed envelope, or the person identifying information is not consistent with the information on the application. High school transcript does not reflect a graduation date. The application did not include a copy of the certificate re-earned, and the pharmacy technician training program failed to complete the affidavit completely. Long-term solution will be resolved when the board transitions to an online application submission that will be programmed with business rules to prevent a number of these issues to address the incomplete information. In the interim, however, the staff continues to work with technician training programs to address issues. It appears appropriate to also include an application information and common deficiencies in a future issue of the script. Any comments from board members? Moderator, would you please open it for public comment?
I have opened the Q&A panel. If you'd like to make a comment, please click on the Q&A icon at the bottom of your screen. Enter "I would like to make a comment" into the Ask field and submit that to all panelists.
Moderator, it appears we're not going to have any public comments. Could you please close the public comment?
It is closed.
Thank you. Agenda item G is licensing statistics, and because of the time, I am going to just point you towards both the board meeting materials as well as attachment 6, where there is a very good summary of our licensing statistics. And I'm going to also mention that our next board meeting is currently scheduled for January 27th. We are looking at possibly having one sooner because of the information from this meeting. I guess I will open up for public comment on those 2 items. Well, let me ask you, is there any board comment on those 2 items? Okay, moderator, can you please open it up for public comment?
The Q&A panel is open. Again, if you'd like to make a public comment, please follow the instructions on your screen, clicking on the Q&A icon at the bottom of your screen, entering "I would like to make a comment" in the Ask field and submitting that to all panelists.
All right, moderator, it appears we're not going to have any public comment on those items. Can you please close the
It is
Q&A?
closed.
Thank you very much. Mr. President, that is the licensing committee report. And it appears you're on mute, just so you know.
Thank you. Given the time, I think we should take a lunch break. It's 12:38. Now it's 12:39. Let's return at 1:15. Thank you.